1. The Committee on Homeland Security will come to order. The committee is meeting today to receive testimony on examining the national response to the worsening coronavirus pandemic. Without objection, the chair is authorized to declare the committee in recess at any point. Today, the Committee on Homeland Security is meeting to examine our national response to the worsening coronavirus pandemic. This hearing comes at a critical moment. The number of U.S. coronavirus cases is surging, topping 50,000 per day for the first time on July 1 and setting alarming records for new cases over the past week. Dr. Anthony Fauci recently warned that U.S. cases could double to 100,000 per day if current outbreaks in the South and West are not contained, putting the entire country at risk. As infections threaten to spiral out of control, President Trump has tried to downplay the impact of COVID-19, calling 99% of cases totally harmless, even as more than 130,000 Americans have died and many more have become seriously ill. Just this week, he falsely claimed the U.S. coronavirus death rate is the lowest in the world, when in fact, it is among the highest. Unfortunately, the president's comment come as no surprise. His administration's response to the coronavirus has been an abject failure by any reasonable measure. He ignored early intelligence on the virus, continues to disregard the opinions of doctors and scientists, including those in his own administration, and perpetuates misinformation about COVID-19 rather than allowing the experts to speak directly to the American people about the disease. Just yesterday, Congress received notification that the president has begun the process of withdrawing the United States from the World Health Organization in the midst of a pandemic, endangering global health against our own interests. The president has shirked his administration's responsibility to prepare and respond to the pandemic and his own obligation to the nation in a time of crisis, shifting the burden to state and local governments and the people and the American people. The effect of American lives lost and damage to our economy have been devastating. The United States currently has 20% of the world's coronavirus cases, despite having only 4% of the world's population. As the countries are bringing their outbreaks under control, U.S. cases are headed in the opposite direction. Meanwhile, President Trump continues to deny the severity of the problem and is instead focused on his own reelection campaign. Many state and local governments, public health officials, hospitals, and medical workers are doing the best they can under the circumstances. But we need real leadership at the federal level if our country is to overcome the COVID-19 pandemic. Today, we will hear from those who are taking action where the administration has failed to do so: a governor, a mayor, a public health official, and an emergency manager. They are in many ways on the front line of this worsening pandemic, obtaining PPEs and testing supplies, requiring masks and social distancing, and sounds the alarm about the devastating effects of this disease on minority and economically disadvantaged communities. I hope to hear their testimony about what needs to be done to reverse the current trend of cases to protect our health and our economy. The American people are counting on us. I thank the witnesses and my colleagues for participating today. The chair now recognizes the ranking member of the full committee, the gentleman from Alabama, Mr. Rogers, for an opening statement.
Thank you, Mr. Chairman, and I appreciate you granting my request to allow members to use the hearing room today. As you know, I strongly disagree with the unilateral decision to shut down the House of Representatives. We should be conducting our important oversight and legislative business here in Washington. We are much more productive when members are here in person doing our work together. We've always proven that we can do it safely. I hope we will return to regular order as soon as possible. As I said before, our hearts go out to those who have lost their loved ones to COVID-19 and those who are currently undergoing treatment. COVID-19 is an unprecedented global pandemic that requires unprecedented response. Unfortunately, we lost time early in the response when China hid the disease from the world. For weeks, the Chinese Communist Party refused entry to outside medical experts. The Chinese suppressed journalists reporting. Worst of all, China deliberately withheld evidence of the virus's structure and deadly spread. During this, the Chinese hoarded life-saving medical supplies and encouraged foreign travel, seeding the virus across the globe. I want to commend Ranking Member McCall's work on the Foreign Affairs Committee to extensively document this deadly cover-up in a recent report. It's clear that China has pulled out all the stops to manipulate everyone from media outlets to the World Health Organization. The WHO maintained for months that China had promptly self-reported COVID-19. They did not. After months of lying, the WHO has come clean. The WHO now says it found out about COVID from media reports and whistleblowers from within China. The Chinese Communist Party once again has been caught with blood on its hand. Facing an extraordinary public health crisis, China's deadly cover-up, the Trump administration has responded with a whole-of-government response. To date, the administration has prohibited the entry of travelers from global hotspots, invoked the Defense Production Act to increase supplies of critically needed medical equipment, such as ventilators, coordinated the delivery of 176 million respirators, 682 million surgical masks, and 17 billion gloves, sent over $125 billion to the states to support medical response to COVID-19, distributed over $500 billion in PPP loans to small businesses, helped facilitate the testing of over 36 million tests. In fact, we are now capable of conducting over 700,000 tests per day. That's good news. The bad news is the number of positive tests are rising in many states. That's why it's important for all Americans to continue to heed the advice of our federal government, state, and local public health officials. I'm pleased to see a couple of public health emergency response officials on the panel today. Colonel Hastings currently serves as the director of Alabama's Emergency Management Agency. He has a very distinguished career, 30-year career in the Air Force. For the last 3 years, he has done a tremendous job leading the EMA's response to several natural disasters and now the COVID-19. Colonel, thank you for joining us today. I appreciate all the witnesses for appearing. I look forward to hearing you all, hearing how you are using the emergency funding and support resources provided by Congress and the administration to respond to this crisis. I'm also interested in knowing what more Congress can do effectively to help you respond. Our country has faced outbreaks of serious disease in the past. In each case, we have marshaled our collective resources and ingenuity to overcome the crisis. I'm confident that will be the case with COVID-19. Thank you, Mr. Chairman, and I yield back. Can y'all hear the chairman? I can't either.
Can you hear me now?
Yes, yes.
All right. Other members of the committee are reminded that under the committee rules, opening statements may be submitted for the record. I will yield to the ranking member for the purposes of a colloquy.
Thank you, Mr. Chairman. Could you please explain our agreement on the committee procedures during these remote proceedings?
I thank the ranking member. Let me begin by saying that standing House and committee rules and practice will continue to apply during this remote proceedings. Members will be expected to continue to adhere to the rules of the committee and the House. During the covered period as designated by the Speaker, the committee will operate in accordance with House Resolution 965 and the subsequent guidance from the Rules Committee in a manner that respects the right of all members to participate. The technology we are utilizing today requires us to make some small modifications to ensure that the members can fully participate in these proceedings.
Thank you, Mr. Chairman. Could you elaborate on how members may expect to be recognized during the remote proceeding?
Uh, Thank you. First, to simplify the order of questioning, I'll recognize members for their 5 minutes questioning based on a strict seniority basis as determined by our committee roster, a departure from previous procedure. Members must be visible to the chair in order to be considered as present for purposes of establishing a quorum or for voting. Members should make every effort to remain visible on screen throughout the proceedings. If a member experiences issues with their video stream, they may proceed with solely audio to ensure connection, provided they have been identified previously. At the beginning of this hearing, members are muted. Members may unmute themselves in order to be recognized for purposes of their 5 minute questioning of the witnesses. At the conclusion of speaking, members will be expected to then mute themselves to prevent excess background noise. If a member does not mute themselves after speaking, the clerk has been directed to mute members to avoid inadvertent background noise. Should a member wish to be recognized to make a motion, they must unmute themselves and seek recognition at the appropriate time.
Thank you, Mr. Chairman. What could a member expect should they encounter technical issues during this remote event?
In the event a member encounters technical issues that prevent them from being recognized for their questioning, I will move to the next available member of the same party, and I will recognize that member at the next appropriate time slot, provided they have returned to the proceeding. Should a member's time be interrupted by a technical issue, I will recognize that member at the next appropriate spot for the remainder of their time once that issue has been resolved. If I should encounter technical issues myself, the vice chair of the committee, if available, or the next most senior member of the majority shall assume the duties of the chair until I'm able to return to the proceedings.
Thank you, Mr. Chairman. What should members expect regarding decorum during the remote event?
Thank you again. Members are reminded that they are only allowed to attend one virtual event at a time. Should they need to attend another committee proceeding, please fully exit the hearing before entering another proceeding. Finally, all members are reminded that they are expected to observe standing rules of committee decorum for appropriate attire and should have a professional and apolitical background when they are participating in any remote event.
Thank you, Mr. Chairman. What should members expect if a witness loses connectivity?
Uh, in event a witness loses connectivity during testimony or questioning, I will preserve their time as staff address the technical issue. I may need to recess the proceeding to provide time for the witness to reconnect.
Thank you, Mr. Chairman. Finally, what should members expect if a vote's called during a remote event?
Uh, HRES 965 requires members to be visibly present to have their vote recorded during a remote event. Members who join the proceeding after a vote is called and who are not called upon for their vote should seek recognition from the chair to ensure their vote is recorded. Should a member lose connectivity during a roll call vote, I'll hold the vote open for a period of time to address the technical issue and provide members with an opportunity to have their vote recorded.
Thank you, Mr. Chairman. I yield back.
With that, I ask unanimous consent to waive Committee Rule 8A2 during committee remote proceedings under the covered period designated by the Speaker under House Resolution 965. Without objection, so ordered. I welcome our panel of witnesses. I yield to the Vice Chair of the committee, Ms. Underwood of Illinois, to introduce our first witness.
Thank you, Mr. Chairman. Our first witness is the Honorable J.B. Pritzker, the Governor of the great state of Illinois. Before becoming governor, Mr. Pritzker was a national leader in early childhood education for over 20 years and earned his law degree from Northwestern University. We're so glad to have him on the panel today to discuss his experience leading a state of nearly 13 million people through this challenging time including one of the largest cities in the country, as well as extensive suburban and rural areas with very different needs. Back in March, we heard testimony from Dr. Ngozi Ezike, the director of the Illinois Department of Public Health, and I'm looking forward to getting an update today from Governor Pritzker. Welcome, Governor. I yield back.
Thank you very much. Our second witness is the Honorable Jason Shelton, the mayor of Tupelo, Mississippi. And for those who are on here who might not know, Elvis Presley was born in Tupelo, Mississippi. Mr. Shelton, after practicing law in Tupelo for more than a decade, Mr. Shelton was first elected mayor in 2013. Under his leadership, the city of Tupelo received a 2015 All-American City Award. Welcome, Mr. Mayor. Since we have two members of the panel who are from Houston, Texas, I'll yield first to the gentlewoman from Houston, Ms. Jackson Lee, to introduce our third witness. And after that, I'll yield to the gentleman from Houston, Texas, also to finish that introduction. Ms. Jackson Lee.
Mr. Chairman, thank you very much. And to the committee members and the ranking member, to all of the witnesses, thank you for your presence at this very important hearing. Dr. Shah, my pleasure, my good friend, Dr. Umair Shah, is the executive director and local health authority of Harris County Public Health since 2013. Under Dr. Shah's leadership, Harris County Public Health is a nationally recognized $100 million agency of 700 public health professionals serving the nation's third largest county with 4.5 million. He has been a strong, important, and interesting but provocative messenger on the importance of the health challenges throughout the nation and really around the world. We work together on the issue dealing with the Zika virus, environmental health threats, creosote contamination, and he has been a strong voice in the needs of the county as it relates to COVID-19 pandemic. Today in Houston, the most important titles a person can have is doctor or nurse, and he is that as it deals with COVID-19 patients. He has been involved with the care of patients as relates to the Harris County Health, and he previously worked as an emergency department physician at Houston's VA Medical Center and as chief medical officer of Galveston County Health District. He earned his MD from the University of Toledo Health Science Center. We're very delighted to have Dr. Umair Shah, who is a voice of leadership, but also guidance during Houston's very, very difficult times fighting COVID-19. Thank you, Mr. Chairman. Delighted to be able to have the privilege of introducing Dr. Shah.
Thank you very much. Now I yield to the gentleman from Houston, Texas, to complete the introduction. Unmute yourself. Well, the gentleman from Houston, unmute himself.
The gentleman believes he's done so, Mr. Chairman. Thank you for the reminder. Greatly appreciated. Thank you to the staff for the outstanding job they've done with this transmission. Saving Al Green, I think we've done an exceptionally fine job. Mr. Chairman, one of the hallmarks of Dr. Shah's luminously illustrious career is that he gets involved. He responds. He responded to Tropical Storm Allison, Hurricanes Katrina and Haiti. He responded to Ebola and Zika. He has served as the medical branch co-director, and he did so at a time when in my district we had some 27,000 persons to move from Louisiana, my home state, to Houston, Texas, into my congressional district. He was there for the evacuees when they were housed over at the Astrodome. I am honored to have him as a dear friend, and we are pleased to know that he serves our constituents not only in the 9th Congressional District, but across the length and breadth of the state of Texas and indirectly across the country. Thank you for being here, Mr. Shah, Dr. Shah, if you will, and thank you for your involvement.
Our final witness, as acknowledged by the ranking member, is Colonel Brian Hastings, the Director of Alabama Emergency Management Agency. Since August 2017, Colonel Hastings previously served in the United States Air Force for over 30 years. For his military service, Colonel Hastings earned 2 Legion of Merit medals, the Bronze Star, and 3 Meritorious Service medals. Welcome to the panel, Colonel. Without objections, the witnesses' full statements will be inserted in the record. I now ask each witness to summarize his statement for 5 minutes, beginning with Governor Pritzker.
Thank you very much, Mr. Chairman. Chairman Thompson, Ranking Member Rogers, and members of the committee, thank you for the invitation to testify about our national response to the ongoing COVID-19 pandemic. Illinois is the 6th most populous state with the 5th largest economy. We have some of the world's best hospitals like Northwestern Memorial and Rush, and we have renowned researchers, modelers, and public health experts at world-class institutions like the University of Illinois and the University of Chicago. And when it became clear that COVID-19 was not a phenomenon limited to Asia or to Europe, we fully expected the federal government, home of the Centers for Disease Control and the U.S. Department of Health and Human Services, would arm the states with information and equipment and testing capability and personnel. After all, the federal government had the experience fighting H1N1, SARS, and Ebola. A global pandemic requires a national response, but that's not what happened. First, though, I want to talk about what did happen. We took action here early with Illinois' hospital leaders, epidemiologists, modelers, public health officials, and emergency management leaders quickly helping to put plans together. We were among the first states to close nursing homes to visitors and do wellness checks on the staff. In consultation with local officials, I shut down St. Patrick's Day celebrations and then closed bars and restaurants and then schools. And we were the 2nd state in the nation to issue a stay-at-home order. The federal government wasn't leading. We were. Illinois is home to the country's 3rd largest metropolitan area and to major international transit and tourism sectors. We had all the potential to become a major early hotspot like New York and like Florida and Texas have now become. Early March projections showed that without intervention, our healthcare system would be overrun, leading to tens of thousands more deaths. Our curve peaked approximately 6 weeks later. Today, our COVID-related deaths per day are down 85% from a high 8 weeks ago. Even as our testing continues to grow to over 30,000 tests per day now, our COVID cases are down 71% from a high 9 weeks ago. And the number of COVID positive hospitalizations, including in the ICU, has dropped by over 70% since early May. Our case positivity rate was over 23% at one point, and it's now at around 2.5%. That isn't to say that the cascade of decisions that got Illinois to this point were easy. In fact, every one of them has been a choice between bad and worse, muddled further by the White House's broken promises on testing supplies and PPE deliveries. I spoke with many of my fellow governors, Democrats and Republicans. They had the same problems. The COVID Defense Production Act was not broadly invoked early enough. We were in a bidding war for life-saving supplies against each other and against our international allies. We were paying $5 for masks that should have cost 85 cents. There were states calling other states to try and figure out if some international businessman offering a warehouse of 2 million N95 masks was a scammer. Many were. In the midst of a global pandemic, states were forced to play some sort of sick Hunger Games game show to save the lives of our people. Let me be clear, this is not a reality TV show. These are real things that are happening in the United States of America in the year 2020. And if there's one job government has, it's to respond to a life-threatening emergency. But when the same emergency is crashing down on every state at once, That's a national emergency, and it requires a national response. Medical professionals across the nation are crying out for supplies. It's the federal government's job to make sure that a nurse being properly equipped in Peoria, Illinois, doesn't come at the cost of a doctor being ready for work in San Antonio, Texas. There was no national plan to acquire PPE or testing supplies, and as a result, people died. I am so grateful to the incredible experienced public servants inside of FEMA, the CDC, HHS, VA, and the Army Corps who worked so hard along the way to give us their expertise and assistance. We will need more of that before we will have vanquished COVID-19. I want to offer my thoughts on what the federal government can still do to step up and help us get through this pandemic. First, we need to see a coordinated national strategy for containment. That means more testing and more contact tracing, and it may even mean national restrictions that will be followed in every state. Second, every state has suffered revenue loss because of COVID-19, and without help, there will be massive layoffs of public servants, teachers, and firefighters. A bipartisan coalition of governors thanks the House of Representatives for taking swift action on state and local support in the HEROES Act. Third, the federal administration also needs to provide clarity on insurance coverage for COVID-19 testing. Testing is not a one-off tactic. We need regular testing across our population. And that means people need to know that their insurance will cover their testing every time. Fourth, we need to continue COVID response funding for the National Guard through next year in the face of a possible, maybe even likely, second wave. And finally, and this might be the most important thing that we can do to save lives, we need a national masking mandate. We instituted ours in Illinois on May 1st, one of the first in the nation, and it aligns with our most significant downward shifts in our infection rate. It's not too late for the federal government to make an impact. In fact, it's more important than ever. So I want to thank all of you, and I look forward to your questions later on in this hearing.
Thank you, Governor. We look forward to your responses to the question. I now recognize Mayor Shelton to summarize his statement for 5 minutes.
Thank you, Chairman Thompson, Ranking Member Rogers, and distinguished members of the Committee on Homeland Security. Thank you for the honor and opportunity to be here with you today to discuss the ongoing devastating impact of COVID-19 on our great nation, and more specifically for me to discuss the impact on local governments. I did hear the chairman mention that can't have political things in the background. I think I've complied with that, but I also do have a not so subtle reminder that I'm from Tupelo behind me, and I hope that that's okay. The adverse impact of the public health crisis and corresponding economic crisis caused by COVID-19 has had a direct negative impact on the ability of local governments all across our nation to provide the basic services that every single American depends on in carrying out their normal day-to-day activities, such as getting to work, providing for their family, and having safety and security in their community. As the members of this committee are aware, nearly 3 million Americans have already been diagnosed with COVID-19, and the number of deaths of Americans is in excess of 130,000 individuals. While some loss of life from the pandemic is likely unavoidable, in my opinion, many of these deaths could have been prevented by a quicker and more uniform response from our nation's Commander-in-Chief and his administration. Rational, stable, and consistent leadership based upon medical and scientific data is desperately needed from our nation's highest office during this very real pandemic. Unfortunately, that is missing at this moment. In the last 6 months, we have seen leaders of nations all over the globe respond to this deadly pandemic with rational, science-based decision-making and genuine concern for their citizens and their economies. We've seen leaders from all over the world step up and rise to the occasion. It is past time to see that leadership here in the greatest country on earth. As was mentioned in the chairman's opening statements, our nation has 4% of the world's population, but over 20% of the world's COVID cases. Similarly, we have over 20% of the world's deaths right here in the United States. My purpose here to speak today is about the hardships faced by local governments, which are on the front line responding to our nation's health and economic crises. Mayors, county officials, parish officials, and others are on the front lines and doing all that they can do to enact local policies that are based on science and the recommendations of our nation's top agencies and experts. Their efforts, however, are being hamstrung by the lack of rational, stable, and science-based leadership in the White House. Due to the continued political climate surrounding COVID-19, our cities continue to have difficulty in getting individuals and businesses to comply with the safety measures to prevent COVID-19 related sickness and death in our city. This will prolong both the health and economic crisis in our community. The city of Tupelo has been very proactive. We initiated our emergency response February 24th of this year. Since that time, I've issued 17 different executive orders, all ratified by our bipartisan city council to combat COVID-19. COVID-19 does not recognize a city limits or even a county or state border. That is why national mandatory policies are needed if we're going to truly combat the healthcare and economic crises facing our nation. I want to take this opportunity as mayor of the city of Tupelo, as a member of the Small Towns Council of the National League of Cities, to thank the members of this committee and this collective body for passing the CARES Act legislation. This is a great thing for our country. I also want to thank the members who have supported the HEROES Act and the SMART Act. Those pieces of legislation would get resources to local governments that are desperately needed. That is the gist of my testimony today, to advocate that direct federal funding be delivered to local governments so that we can offset the loss of revenue. The National League of Cities anticipates about a $360 billion loss of revenue for local governments over the next 3 years. We need funding to be able to provide the very basics that every American depends on to get to work every day. Garbage, trash collection, litter, fixing potholes, fixing a red light that's not working, fire protection, public safety, EMTs, the things that every American depends on each and every day. Those things, those functions of government happen here at the local level. The lost revenue due to the economic crisis of COVID-19 is going to severely diminish our ability to provide those basic services, and that's why direct funding from the federal government to local governments is desperately needed. Former Speaker Tip O'Neill famously said that all politics is local, and while the solutions will likely be debated in Washington and our state capitals, they will be implemented where literally the rubber meets the road, right here in our local governments. Thank you again for allowing me, Chairman Thompson, Ranking Member Rogers, members of this committee. Thank you for allowing me the opportunity to be here to advocate for local governments. And I appreciate the opportunity to speak to you and look forward to answering any questions that you may have for me. Thank you.
Thank you for your testimony. I now recognize Dr. Shah to summarize his statement for 5 minutes.
Thank you, Chairman Thompson, Ranking Member Roger, and members of the committee and subcommittee. Members of the Texas delegation, Representatives Sheila Jackson Lee, Al Green, Dan Crenshaw, and Michael McCall. I want to thank all of you in particular. My name is Dr. Umair Shah. I'm the Executive Director and Local Health Authority for Harris County Public Health. I'm past president of NACHO, It represents the nearly 3,000 local health departments across the country. Harris County is the third most populous county in the United States with 4.7 million people, including the city of Houston is one of the most diverse and fastest growing metropolitan areas. Population in our community is larger than 25 states. We are no stranger, unfortunately, to emergencies such as storms, hurricanes, fires, and infectious disease responses. From a public health standpoint, there truly is never a dull moment in our community. Unfortunately, the present COVID-19 pandemic has had an unprecedented impact on our community and our nation well beyond health and has undoubtedly tested the resolve of the American people. Harris County Public Health has responded to H1N1 for 18 months back in 2009, 2010, but tomorrow marks only the 6-month mark for COVID-19. We're truly in a marathon, not a sprint. Today, I'm here to make 3 main points. One, we as a nation still have the opportunity to fight this pandemic, but only by working together. Number 2, all eyes are on Harris County in Texas right now, and despite being successful previously, the situation has now changed. And number 3, public health is key, and we must support and invest in it. Let me start by saying that the local response to COVID-19 led by Harris County Judge Lina Hidalgo has been strong, decisive, and proactive, and has worked closely with other area officials, including Houston Mayor Sylvester Turner. Case in point, Harris County released its 4 T's approach for addressing COVID-19: test, trace, treat, and teamwork from March to May. This approach saw the Houston Harris County community working together successfully to flatten the curve. More recently, the story has changed. Our community has seen an increase in cases, the percentage of tests that are coming back positive, and hospitalizations, including in our county's safety net hospital system. Our threat level for COVID-19 has been raised to red, its highest level. We now have over 39,000 cases and 400 deaths in Harris County. The changing picture in Harris County now demonstrates what I have called the layering effect of reopening in Texas on top of events and holidays such as Mother's Day, Memorial Day, protests and marches, further layering exposure and risk to our community. Inconsistent messaging at the federal, state, and local levels have led to further confusion and complacency at the individual community level. Case in point, CDC has not been consistently visible as the nation's voice of public health. In Texas, while many local officials, elected and health alike, stated clearly that our state was reopening too quickly, the process of reopening continued. Powers of authority previously available at the local level were removed. Fortunately, the state has now begun to dial back reopening. Reopening responsibly means that decisions should be driven primarily by health and medical while balancing other interests. Public health often gets the short end of the stick. It has been chronically underinvested in. I call this the hashtag invisibility crisis. While I've come to this committee before to share similar points, enough is enough. We need to take this seriously if we are ever to course correct in time to protect our communities. Yet when we need it the most, public health is still largely invisible, underappreciated, and underfunded. The COVID-19 public health workforce has been working well beyond 40 hours a week, available 24/7, months on end. The public health frontline is committed, but it is facing burnout and stretched to its limit. In the span of 4 months, our department has doubled its own workforce. Our epidemiology team has gone from 25 to 500. This massive scaling for COVID-19 has proven necessary, but without reliable and secure funding outside of reactionary and supplemental funds, it is simply not sustainable. Daily, our leadership juggle needs between essential public health services and the COVID-19 response, and we are not alone across the country. This is where the federal government comes in. The primary financing mechanism to expand capacity is through CDC's ELC grant. For example, our department is ineligible for direct funding, and yet the same mechanism has been used for the COVID-19 response. The pandemic must be fought together. It has felt like every health department has been left on its own trying to create new systems for response in real time. While federal support is appreciated, federal testing sites were planning to cease operations at the very time we were seeing increasing need. Similar issues are likely to play out again when vaccinations become available, meaning proactive planning for vaccine distribution is needed soon. Although scaling of testing has increased, results take too long to reach health departments, especially at government-supported sites. The data exchange is moving slower than the disease. With this delay, public health measures become less effective. This is especially true for those most vulnerable, such as disproportionately impacted communities and those in congregate settings. We're equally concerned with the health inequities seen in Hispanic and African American communities in this response. If the federal government expects there to be robust systems of surveillance, better data and informatics capacity is needed at the local level. This includes CDC support for innovative study of disease patterns in Harris County, utilizing state-of-the-art technologies and genetic sequencing. As a workaround, our department has had to develop new data systems, public-facing data dashboards, and online screening tools for testing on its own. Those local efforts are necessary to get the job done, but they're reactive as national efforts to modernize such systems have failed. Let me close by saying the pandemic is an unprecedented time for our country. We are being tested like never before. Smart, strategic, scalable, and sustainable investments are needed now. All eyes are on Texas and Harris County. We should be able to look to the federal government for leadership and support. On behalf of Harris County Public Health and our public health colleagues across the nation, the offensive line of the football team, I appreciate again the opportunity to testify today. Along with our local leadership, we join you in working together in fighting COVID-19 to protect our national security, our economic vitality, and the very health of our people. Thank you.
Thank you very much, Doctor. I now recognize Colonel Hastings to summarize his statement for 5 minutes.
Good afternoon, Chairman Thompson, Ranking Member Rogers, and members of the committee. On behalf of Alabama Governor Kay Ivey, thank you for inviting the Alabama Emergency Management Agency to participate in today's hearing. I'm here before you as the director of the Alabama Emergency Management Agency, and we are the state's lead agency for the coordination of Alabama's all hazards mitigation, preparedness, response, and recovery activities. Thank you for the opportunity to share with you Alabama's perspectives and our experiences preparing for and responding to COVID-19. Over the last 4 months, Alabama has transitioned from a stay-at-home order issued on 20 March to a safer-at-home order issued on 30 April. The latest order from Governor Ivey has recently been amended and extended through 31 July. When this pandemic began, Alabama was fortunate that ADPH, our Department of Public Health, had on hand an existing stockpile of PPE left over from the H1N1 response over a decade ago. This stockpile of PPE was mostly expired, but was able to be distributed early in our response to COVID-19 with the help of a waiver granted by the U.S. Food and Drug Administration. The initial push of ADPH's existing PPE stockpile, combined with a slow rise in COVID-19 cases and the release of federal strategic national stockpile, helped reduce the initial shock of the global PPE supply and demand crisis. Today, the healthcare supply chain is still struggling to provide medical-grade respirators, some disinfectants, and other specific personal protective equipment. This supply and demand mismatch continues to plague Alabama, just as in many other states, as we continue to provide PPE to the healthcare system while simultaneously working to replenish our state stockpile in preparation for the fall surge of COVID-19. As a state EMA director, I appreciated the more active role FEMA played as the U.S. coronavirus response evolved. Even though the dual reporting change of HHS and FEMA were sometimes cumbersome, it was better than not receiving critical coronavirus response information, and the relationship provided much needed visibility into the U.S. public health response at a national level that we lacked to some extent during the early days of the federal government's response. The combination and co-location of FEMA and HHS leadership was mirrored in Alabama's own unified command stood up on 30 March. We found that this helped our communication information flow across and within our state agencies. This combined construct with the close coordination enables between emergency management and public health officials should be purposefully encouraged in federally supported preparedness programs. This would reduce duplication and streamline coordination and preparedness outcomes driven by the separate HHS and DHS FEMA emergency preparedness funding programs, of which FEMA's emergency management performance grants and HHS public health emergency preparedness programs are two prominent examples. As the U.S. develops future strategies and policies for pandemics, all hazards emergency management activities, and threats to national security, I offer a few items for consideration to our federal partners. Assess public health vulnerabilities to national security based on comprehensive supply chain analysis to include the location of raw materials, availability of production resources, transportation vulnerabilities, and location of manufacturing. 2, with regard to the CARES Act and the crucial financial support it provides to state and local government, there are lingering questions about eligibility that at this time are causing some level of confusion at the state and local levels. For example, it is unclear whether CARES funding may be lawfully used to accommodate the extraordinary expenses of emergency management agencies like AMA, that have been incurred in responding to COVID-19, even though the vast majority of our personnel expenses have been dedicated to that end to date. Increased clarity on the intended and allowable uses of CARES funding would enable state and local officials to make better decisions about the most effective and responsible uses of this essential emergency funding mechanism as we work to maintain government operations during this crisis. Requirements that are too restrictive or specific in our emergency preparedness funding programs, whether in authorizing legislation or in the implementing guidance passed down from federal agencies, often create very distinct functional cylinders of excellence and siloed functional expertise in a way that is inwardly focused, instead of enabling cooperation and sharing of resources in a fully integrated national emergency management and preparedness enterprise. Our focus should be on fostering an outward sharing of resources and information that is incentivized by federal grants aimed towards developing capabilities with commonality, interconnectedness, and partnerships instead of driving duplication, competition, or stovepipes. This is especially pertinent in terms of overlap between and sometimes competing objectives of the FEMA and HHS emergency preparedness funding programs. And lastly, in accordance with FEMA's framework of federally supported, state-managed, and locally executed disaster activities, please give consideration to the role that subdivisions of government and private partners should play in stockpiling resources for future pandemics or building local capability. If the federal government focuses too much only on federal responsibilities, the U.S. may miss an opportunity to create a whole of government and whole of society approach to preparing for future pandemics and complex disasters. We all play a role in emergency preparedness, so the strategic national stockpile should be a multi-tiered national system comprised of integrated whole of government, whole of business, and whole of society partnerships to strengthen the resiliency of the United States at all levels: state, local, tribal, territorial, and federal. In conclusion, I'm proud to say that Alabama remains committed to fighting the coronavirus, reducing loss of life, and minimizing the suffering of our citizens. As our nation continues to respond to this public health crisis, we ask that you remain attentive to the evolving needs of each state, in particular Alabama, and mobilize the information, resources, and funding capabilities of the federal government that are needed to protect our nation's public health and safety. Again, thank you for this opportunity to testify. Thank you for your support of the CARES Act and to our federal partners who have partnered with us in the response, and I welcome your questions. Thank you.
I thank the witnesses for their testimony. I remind each member that he or she will have 5 minutes to question the panel. I'll now recognize myself for questions. Governor John Hopkins University has documented the disproportionate number of deaths in the U.S., the disproportionate number of testing. How do you think we got to this point in the United States that our people are dying more disproportionately than others? And after you say that, can you give us what you think we ought to be doing that we didn't do?
Well, you're talking about communities of color, right? I just want to make sure, because from my perspective, this is something that was so overlooked in the very first weeks of the pandemic in the United States. And then as the data was coming out, I think all of us, that care about this jumped on it and tried to figure out what are the things that we can do to make up to try to, diminish the negative impact of coronavirus, particularly on the African American community, the Latino community, the Asian community. Here, look at this is the conclusion that you have to reach, which is this is a result of, frankly, hundreds of years of failure to invest in basic healthcare, basic needs, investment in communities that has been lacking for so long. And the result is that, you hear a lot about the comorbidities that exist in the African American community. Well, those don't just exist by accident. They exist because we haven't invested in those communities. And so people suffer from the comorbidities more, guess what, in communities where there's more poverty. From my perspective, to counter this, we put a lot of testing capability into, at least here in Illinois, into communities of color, particularly Black communities. We've seen, of course, a disproportionate number of Black people who get coronavirus dying from coronavirus. We also see a disproportionate number of Latinos getting coronavirus relative to their population size. And so in both of those circumstances, we had to react. There are different challenges in each of those communities that we had to react to. But when you ask me what are the causes, I mean, the causes are things that have existed for many, many years that only now, I think, not just with coronavirus highlighting the failures, but now on top of that, the recognition as a result of the outpouring of protest and peaceful protest in the wake of the murder of George Floyd, that we need to do so much more, and we're not prepared in this pandemic to deal with it. We need to make sure that we're doing everything we can now, but we also need to make sure we put the resources in so that, God forbid, that we have another pandemic. This isn't.
Thank you. Dr. Shah, you talked about a few things that we could do right now to try to mitigate the increase in the numbers. Can you kind of repeat that for the members again?
Sure. Thank you. Thank you, Mr. Chairman. To say it very bluntly is that we have to make sure that we are consistent in our policies and our messaging. I think that is the number one thing. The second thing is that we also have to make sure that health and medical and science and evidence, the best we can, we know it's not always there because this is a novel disease, that is also driving those decisions. And we're particularly concerned about the CDC and the fact that the visibility and the leadership that we've seen previously with CDC that has not been noted, at least at the local levels in public health, and that is a significant concern. And then I do think that there are some preventive measures that are very much about the masks and really ensuring that we have the policies in place from a prevention standpoint that really can be very much a part of the solution forward. We have to be smart about it, but we also have to be thinking about how we can continue to move this process forward, because the phased approach that we're having in our community is very different than the governor is having in Illinois right now, or you're having in Mississippi. Everybody's going through this at different times, and so we all have to be working together.
Thank you very much. Mayor Shelton, you were one of the first municipalities in Mississippi to require masks of your citizens, and your council supported you. How did you reach that conclusion? Unmute yourself.
Apologize for that. Thank you, Chairman. We began our emergency protocol February 24th. We saw the pandemic coming towards us, so we made the decision then that this is an emergency, so we have to treat it like an emergency. So the 17 different executive orders have done since then have all been based on the recommendations of either Dr. Fauci or the CDC, the Mississippi Department of Health. We've tried to follow the science. We've had we have the nation's largest rural hospital here in Tupelo, the North Mississippi Medical Center. A lot of the requirements that we've mandated have come from requests from the North Mississippi Medical Center. I appreciate getting credit for that, though I want to take up from my friend Mayor Robin Tannehill in Oxford and some of the others. Tupelo was not the first on the mask. We have been first on shelter in place and some of the other things, but I want to give credit to my fellow mayors for credit's due. But we base those decisions on the science, the recommendation, and in our case, the request of our medical professionals here. This is a healthcare crisis. We have to listen to our healthcare professionals. We have to make sound decisions based on the science.
Thank you very much. At the request of the ranking member, we're going to recognize Mr. Higgins, who has a flight to catch. Gentleman from Louisiana, recognized for 5 minutes.
I thank the chairman and the ranking member, and I thank the chairman for holding this hearing. As the chairman and my colleagues are aware, I respectfully object to House proxy voting and remote committee attendance. The Senate is open and working in person. The White House is open and working in person, yet the House is not. Walmart, Home Depot, Lowe's, grocery stores, police departments, fire departments, maritime ports, airports, all open, working in person, but not the people's house. That's my position on that. I respect that of my colleagues, but it's important that we clarify our stance on this during this era of challenge. I have a question for the governor. If you would, good sir, could you briefly summarize what formula have you used to deliver CARES Act relief funding into your local government entities? This is a challenge across the country, and I'm interested to hear how you've handled that.
Yep. Well, thank you very much, Congressman, for the question. Let me start with, we began in Illinois with a challenge. We didn't have a method, an entity through which we could distribute those funds. So we had to go to our legislature to have them pass a law to allow us to do that. They did that. The legislature hadn't met during the spring until mid-late May. And at that point, the legislature created the opportunity for us to distribute those funds. There's a direct amount of money that goes directly to the counties and cities across the state, the ones that are outside of the Northeast metropolitan areas, which get those funds through their counties that got funding directly. So the state.
So generally speaking, Governor, in the interest of time,
Yes.
would it be fair to say that as the executive of your state, you responded to a challenge that has never been faced before, and you have navigated your way through it within the parameters of the law, and you've done your best to respond to the local and municipal governments within your state? Is that a fair summary of your endeavor?
Yes, sir.
And for the subsequent governor, I'm sure you're a fine gentleman and supported obviously by the majority of the citizens of your state. Well, would it be fair to say that for the subsequent governor, you have now determined a path forward for this particular type of challenge that was not known until you navigated through it?
Well, I wouldn't say that we've got everything figured out, Congressman.
But you're working on it.
But we certainly have. There's an awful lot of learning that's taken place from March
That's
until
right.
now, and yes,
So-
I believe that we've created a path for someone in the future to follow.
Thank you. And may I respectfully state that that's exactly what our president has done in response to this incredible challenge that we've never faced before as a nation. I would like to ask the mayor, Mr. Mayor, what's your perspective, sir, for your municipality? Very briefly, have you had problems receiving funds, CARES Act relief funding from your executive? Yes or no?
Congressman, as you know, the CARES Act specifically prohibits loss of revenue funds to be
I understand.
spent.
And yet every state executive had received massive amounts of the people's treasure intended to be distributed by the state executive into local and municipal governments. So as a mayor, you stand like a smart and compassionate man, and we thank you for that. Have you had problems receiving that funding?
Congressman, again, the lost revenue funding is not available. My understanding is that the state is going to send for the PPE funds.
So you haven't received funding yet from your executive?
I'd have to double check that, but not that I've been made aware.
All right, thank you, sir. I don't know how much time we have remaining. We're absent a clock, is from what I can see, but 17 seconds. Mr. Hastings, I'll leave you with this question. Do you believe that a public health crisis is best addressed at the local and state level or by federal mandate? And I yield.
I think it depends on your perspective. Growing up in the emergency management community, our strategy for handling all hazards is federally supported, state managed, locally executed. So we try to adhere to that as we partner with the federal government, with our state agencies, and our counties and municipalities, which are the pointy edge of the spear. A caveat to that might be is that as the sixth poorest state in the union and heavily rural populated state, there are some counties and municipalities that need extra support. So we are sensitive to that and identifying gaps and then trying to plug in both federal and state capabilities and resources in those areas as we can.
Thank you for that response. I thank the chairman and the ranking member, my colleagues across the country right now and here in DC. Mr. Chairman, I yield.
Thank you very much. We now yield 5 minutes to the gentlelady from Texas, Ms. Jackson Lee.
Thank you very much, Mr. Chairman. I appreciate it very much to have the opportunity. Thank you to the witnesses. In 2016, the Obama administration developed a strategic playbook on pandemic preparedness. The playbook entitled Playbook for Early Response to High Consequences, Emerging Infections, Disease Threats, and Biological Incidences. I'm reminded of the Ebola pandemic or the Pandola episode, and it started, or it was certainly focused in Dallas, Texas. Had it not been for the focus of the Obama administration on infectious disease and cooperating relationships with the federal government, there is no way of knowing how disastrous Ebola would have been in the United States. The playbook was in the Trump administration, left behind, and it reportedly did not heed its guidance. The mortality rate was cited by the administration as the lowest in the world as it relates to COVID-19. John Hopkins indicated that it is the sixth worst in the world. We also heard the words that COVID-19 would go away like magic. Governor Pritzker, thank you for your leadership. Would you created on top of a disaster when there is no national effort, there is no national strategic plan to be able to deal with COVID-19?
Well, thank you very much, Congresswoman. Let me just begin by saying that we had immediately, we knew we needed supplies. And so PPE was something, certainly a term that don't think I had ever used before in my life. And all of a sudden, we were out in the marketplace competing for the most basic things like N95 masks, gowns, and such to make sure that our hospitals were supplied and then our first responders and so on. And we're competing against every other state in the United States. States that have more resources than we do, countries that have more resources than we do, with no help from the federal government, no invocation of the Defense Production Act to help us out. So that was just the very first manifestation of the problem that, people were going to work, our heroes, our nurses, our doctors, going to work unable to use PPE that was so necessary to keep them healthy so they could
Governor,
keep other people healthy. And so
we
that
thank
was
you
just
for your
one example, but I'll just add that the testing supplies, were impossible to get, and the federal government was, nowhere to be found for too long on that topic.
For those of us who've interacted with the military, we know the saddest terminology is MIA, missing in action. Very sad terminology. We mourn and continue to look for our soldiers. But when you're MIA, lives can be lost. You think lives have been lost throughout the United States because of that ineffective national strategy?
There is no doubt about it. Thousands and thousands of lives have been lost, tens of thousands across the nation as a result of the inaction, the late action taken by the administration.
Thank you, Dr. Shaw. Thank you for your leadership. Let me just cite right now into the record, Harris County has confirmed cases today, 39,311. There have been 395 deaths. This is as of 7 a.m. July 8th this morning. Houston, 55,000 cases confirmed, 581 deaths. This is in totality. I have a document in my hand that I ask unanimous consent to put in the record, Texas coronavirus timeline that was done by a number of individuals reported in the Houston Chronicle that indicates May 1st was when our orders was lifted, stay-at-home orders were lifted rather, and then we proceeded to open everything up, and we are now where we are today. Would you please respond to the idea of the ineffectiveness of saving lives when there is no national strategy, or when there is the early and too early opening up of states in particular? And then finally, when there is no cooperation, is it important to have cooperation between county and city governments? And I want to thank Judge Hidalgo and thank Mayor Turner for their leadership. And also, if you would comment on what happens when 5,000 persons are coming to a community that's asked them not to come to, and all of the resources that will have to be used as these people congregate for a convention.
Yeah, thank you, Congresswoman, and thank you again for your support. Let me unpack that as quickly as I can in the interest of time. First and foremost, that in any time you have inconsistencies that are occurring across that chain of federal, state, local, I don't really care where it's at. That's where you have the problems in the community, and that's where my biggest concern is when it comes to what we've really looked at from why people are coming together. It does not matter from a public health standpoint whether it's a red or blue issue, whether it's a left or right issue. When people are coming together, that layers risk on top of each other. And that's the biggest concern, especially if it's an indoor. There is some difference between indoor and outdoor, but definitely an indoor. The other aspect of this that I think is absolutely critical is that as we have played this out, the state and local dynamics are absolutely critical. But when you have the federal government not having a national strategy, what that does is that everybody is fending for themselves. Everybody is doing things differently. While we believe in really state and local nuances, we also believe there should be a path forward that the federal government provides, as we've seen in previous emergencies.
You know, I've worked on testing sites. I'd just like to have you emphasize how important it is to have testing sites, how important it is to continue to have the federal government maintain its testing sites, and how eager Harris Countyans and Houstonians are desperately in need of tests.
That's absolutely right. Testing is the foundation of this response. Folks have focused on contact tracing and all these other, terms in public health as if these are new terms. These are things that we've been doing for decades. But the foundation remains testing. Testing gives you then the cases. Cases then allow you to determine, after investigating, who are the contacts, and that's when contact tracers come into play, and then they turn around and reach out to individuals to get them tested, and you start that whole cycle over again. That's why testing is absolutely critical. And Congresswoman, I've said you cannot trace without a case. And so testing is the foundation, and we do need to have that testing support from the federal government.
Gentlelady's time has expired. We now recognize the ranking member from Alabama for 5 minutes.
Thank you, Mr. Chairman. Mr. Hastings, unfortunately, Alabama's had several natural disasters over the last 3 years that you've had to manage. How are you and your fellow EMA directors adjusting your plans to this health crisis created by COVID-19? And are you getting adequate support from FEMA in this planning process?
Ranking Member Rogers, thanks for that question. In my written testimony, it talks about this has been a banner disaster year again for Alabama as the 7th worst major disaster declaration state in the union. We have been complying with all the CDC and public health guidelines through the transition of stay at home and safer at home. And since we have been essential personnel, we haven't stopped a beat since the beginning. So at the beginning of March, we went into remote and dispersed operations. We deployed our people away from the EOC and stayed connected via IT. And we did not accept, since I declared everyone essential personnel, no one received unemployment, and we kept working. So what we did is we just made sure that we wore masks when we were close to people. We socially distanced as we went out into the communities and working with our counties, because the locals is where the disasters happen, just like politics. And so we have changed the way we have done business. Now, there are some people who did not like that we went so early into remote and dispersed operations, but we were just executing the pandemic annex of our emergency operation plan. And we're fortunate to have our own IT division and a separate network that allows us to do those things. In preparation for the hurricane, which has had a lot of attention recently, we're working with the CDC guideline, public health guidelines, FEMA preparedness plans, the Red Cross, and local communities, both Baldwin and Mobile County, to re-examine the preferred method of non-congregate sheltering. But it's very challenging because, as well as you know, between the coast and middle Alabama, there's not a whole lot. It's the rural South. And so to find opportunities for non-congregate sheltering to house people in a disaster is very challenging. So we're going to have to find a blend of congregate sheltering, complying with public health orders, and then also as soon as we can get our survivors, our evacuees, the folks looking for shelter back into some type of non-congregate shelter in a hotel, a larger amphitheater, or some of those larger coliseums that we have in Montgomery, Alabama, and a few places in the coastal counties. But it has entirely changed everything that we do. And it's made us question of whether we can even go to the state emergency operations center, because you only have 2 feet, 3 feet between 125 people, 100 feet below ground. So we've also looked at other opportunities like the RSA towers in Montgomery, of where maybe we, on a floor or Joint Forces headquarters of the National Guard, we would stand up a Joint Force office and administer and partner with our federal, state, and local communities to manage and navigate a disaster in the upcoming season. I hope that answers your question, sir.
Yeah, well, both the chairman and I care very much about hurricane preparedness, so I appreciate that. But back to COVID-19, you heard Governor Pritzker talk about the demand for PPE. How has Alabama managed demand for PPE outside the healthcare sector?
It's been challenging. As it's evolved, there are portions of the PPE that are now available to us. So we just got 2.5 million cloth masks. We helped the Alabama Superintendent of Education procure 2.5 million masks, partly youth masks and adult masks for the upcoming education season. But where we are having problems, and it's hard to get visibility of the health of the supply chain, and also to actually get our hands on these medical grade masks, are the N95s. So we still have a shortage. As soon as we get any of those in, whether it's from the federal government or a stockpile, it goes right out to the hospitals, and the hospitals are receiving those both from the task force of the White House through normal supply chains, but it's not normal yet. It's not to the levels that it was pre-COVID-19. And then we are working through the big six supply chain, and we have a call with the federal government, the supply chain task force, on Friday to see how Alabama, a small state, can maybe partner with the federal government, other regions, to get higher prioritization for these critical medical masks, both for our hospitals now and to build a stockpile for the upcoming fall COVID surge.
Okay, Mr. Chairman, my time has expired. I'll yield back.
Thank you very much. Chair recognizes the gentleman from Rhode Island, Mr. Langevin, for 5 minutes.
Thank you, Mr. Chairman. I want to thank all of our witnesses for their testimony today. Governor Pritzker, if I could start with you. Thank you for being here today. I just want to go back to the discussion about PPE and really the dire challenges you had in acquiring PPE for your state to begin with. You described it as a Hunger Games competition, so to speak. So I think you and I would clearly agree that it would have been much more effective for the president to truly invoke and use the Defense Production Act where they could have been both used for acquisition and distribution of PPE. We would have gotten a bulk price. The taxpayer would have got a lower price and would have been distributed more effectively. It was the position of the administration, and I've had the opportunity to speak directly with the director of FEMA, that they would acquire the equipment and then they put it into the pipeline, so to speak, but not using the Defense Production Act. Can you tell us where we are today? Did that strategy ever work in terms of putting into the commercial pipeline? How are you in other states doing today in terms of being able to access PPE now?
Two different answers. First of all, the air bridge, as you're talking about, the air bridge was designed to bring supplies, and give them to distributors in the United States who already had a list of customers, not based upon where the need was for dealing with COVID-19, but simply customers that were pre-existing that they needed to provide supplies to, because that's what you do for your customer list, and prioritize them based upon your business dealings. Those supplies, sure, they work their way through the United States, but not prioritized for COVID-19. So I think the air bridge was an utter and complete failure in the sense that most of the supplies need to go to areas where there's a great need, and not necessarily to where some private for-profit distributor thinks they need to feed a pre-existing customer. So that's one thing. Where do we stand now? We have been constantly, from day one, we've been out in the marketplace competing to get PPE, and the state of Illinois as a buyer. I remember I had many conversations directly with manufacturers, and I can remember one in particular who basically said to me, look, unless I will allow you to acquire this amount of these PPE items or this equipment, if you will up your order by X amount so that you're greater than this other customer who is promising to acquire a certain amount. So essentially pitting me against another customer in an environment in which we have a pandemic, people are dying. I'm having to make decisions, based on some business person's desire for greater profit. So that was very troubling. Today, we have acquired a lot of PPE. We've made sure that we've got a constant supply, and we have orders that are ongoing on a regular basis. And I would say prices have come down. The environment is a little bit better. It's not back to normal. Someone else on the panel said, this is not pre-COVID pricing, but we're paying a lot less today than we were at the very beginning, and we're able to acquire PPE here in Illinois.
All right, thank you. And hopefully that's the case with other governors in other states, but clearly not the most efficient system. It would have been better to have the PPE be directed to where it's needed most based on need. Let me ask this on pre-existing conditions and health insurance. On June 27th, President Trump had tweeted the following statement. We said, "I will always protect people with pre-existing conditions, always, always, always." Now the Washington Post fact checker has stated that this claim is untrue. So the president's claim that he would protect pre-existing conditions received this rating in part because, and I quote, "in the middle of a pandemic, against the advice of many Republicans, the president is trying to ask the Supreme Court to strike down the entire Affordable Care Act, including coverage guaranteed for people with pre-existing conditions." So, Governor, I want to ask, how does the lack of health insurance, especially in vulnerable populations, exacerbate the current public health crisis? And Governor, as we approach the 30th anniversary of the Americans with Disabilities Act, and I'm someone who lives with a disability, how important is the Affordable Care Act's guaranteed coverage of pre-existing conditions, particularly for people with disabilities?
Well, the guarantee of coverage for pre-existing conditions is vital. It's probably the most important aspect of Obamacare and the expansion of Medicaid. And the idea that we would do away with this, particularly at this moment in history, seems just unimaginable to me. Look, first, we've got to make sure, and I mentioned it in my remarks, we've got to make sure that everybody knows they can get a test for free. they shouldn't be dissuaded from getting a test, thinking this is going to cost them, a lot of money. Hopefully you've got private coverage, but if you don't, let's make sure everybody can get a test, because that's the most important thing, along with contact tracing, that we can do going forward, masking being another one, so that we can identify, testing allows us, and contact tracing allows us to identify where the outbreaks are and minimize them. So we want people to get tested. And then, of course, when people get sick, I mean, this is a national emergency. People should be able to get health care. They should be able to get treated. We should be keeping everybody alive, and not having people think about whether or not they should go to the hospital in the first place when they're contagious, and when they're symptomatic. So I'm very concerned about where we are. And all I can say is that we've got to make sure we maintain our Medicaid coverage, and make sure that particularly people who are having difficulty getting testing know that it is absolutely free to them.
Good. Governor, thank you very much. I know my time's expired. Chairman, I yield back, but I thank all of our witnesses.
Thank you very much. We now recognize the gentleman from New York for 5 minutes, Mr. Katko.
Thank you, Mr. Chairman, and thank you all for being here. Governor Pritzker, just a very quick, succinct question. Via the air bridge, did the state of Illinois get stockpiles of PPE that were being brought in, and then you decide where to disperse that throughout the state? Because I know that's what happened in New York.
Not through the air bridge. The air bridge was bringing in equipment, PPE, that was being given to distributors. And to the extent there were government entities that happened to be on the customer list of the distributors that received the supplies, they may have received them. But in terms of what we got as a state, we were asked at the very beginning, Congressman, what do we need? Which is a terrific question for the federal government to ask. So we put forward a list of all the items, gowns and gloves and N95 masks and so on that we needed. We have in total, from the very beginning to now, we've received about 12% of everything that we asked for. So at some point, the federal government just gave up on delivering.
No, I understand what you're saying, but I just want to question, did you receive anything from the air bridge? And the answer is no. Did you receive stockpiles from FEMA at all? Then you decided where they would go?
We did receive, that's what I'm talking about, the 12% of what we asked for. We received 12%, and we were able to direct that where we thought it should go.
And you were aware, were you not, that the biggest problem with the PPE shortage at the beginning of the crisis, and it got exacerbated as the crisis spread, was the fact that our national stockpile was not where it should have been, correct?
That's true, yes.
And that has been a systemic problem that's spanned several administrations, not just this one.
I'm not sure. All I know is the federal government didn't have what it needed.
Right. Okay. That's what I thought. Okay. So tell me, I got a quick one, another switching gears briefly, Governor. Did you ever institute a policy in Illinois whereby individuals that came from nursing homes that had been infected with the coronavirus were sent back to the nursing homes after being diagnosed?
We did not institute a policy like that, no.
Why not?
We wanted, well, number one, we were making sure that the hospitals were releasing, if they were releasing nursing home residents, that they were COVID free. So
Right.
When they went back to their nursing homes, they were COVID free. That was something that we had. And also in our nursing homes, we had a policy of making sure that the nursing homes, or we provided for the nursing homes, the policy that they should separate, of course, COVID positive from COVID negative residents, and many of them did. I will say some of them didn't do it right, and we're holding them accountable.
Okay, thank you very much. Mayor Shelton, I love Elvis, so I'm going to ask you some questions. When I left as a federal organized crime prosecutor in El Paso, my parting gift was a velvet Elvis picture. So, and I still have it in my office today. That was 20 some odd years ago. I'm curious. You're a city of less than 500,000, and where I rep my home's in my area, my district. I have a city of Syracuse, which is less than 500,000, and the county it's in, including the city, is less than 500,000. So, under the CARES Act, they have received no direct funding, and I presume you have not either.
That's correct, Congressman.
Have you received any funding from the state that was sent by the federal government?
No, my understanding is we have not. Now, we have been told that we have been approved for some funding for different things. But as far as actually receiving those funds, and I just asked my communications director to double check, and she said we had not. But my understanding is we've not actually received any of those funds of the $1.2 billion that was sent to the state of Mississippi.
Yeah, here's the oddity with our, just to the right, Syracuse and the city and the kind of Onondaga received no money. Similar to you. Just to the west of me is the city of Rochester and the county of Monroe. And because they were just over 500,000, they received over $120 million in the last package. So the disparity in support for the two cities is stunning. So tell me, as a small city, and what you would do if you got that money, and what it would help you prevent to it.
Well, thank you, Congressman, and that is the crux of the matter. So the things that we would do are basic city services. So every business in the city of Tupelo has to make sure that literally the lights are on the streets, that you have first responders, that you have firefighters, that you have police officers, that you have the ability of public works to respond if there's a water break, some sort of, the incidents that happen in cities every single day, fixing potholes, cleaning up, beautifying the city. Those basics that's what's in jeopardy by the cities collectively losing $360 billion. So, we have the big picture issues in Washington and our state capitals, but the nuts and bolts of American society happens in our small cities and in our counties all across the country. Those basic city services of literally being able to drive down a decent street and have functioning red lights, have your garbage picked up at your curb, have litter or debris picked up, those basic services. And then you get beyond that when talk about economy, the permitting office, building inspections, code enforcement, all of those local offices that are necessary to make sure that businesses are open and running, that a new business can get a occupancy permit, that a new construction project can be inspected. All of those type things are jeopardized by the loss of revenue to cities and counties across the country. When we don't have the money, we have to do cutbacks or furloughs, and those basic city services don't get performed, and that it has a direct adverse impact on mom and pop businesses and individual families all across the nation.
I appreciate that. It's very helpful. And lastly, I want to thank you, Governor Pritzker, for acknowledging that you've done an awful lot of learning during this crisis. I think we all have. And I think that starts at the top of government all the way down to the states and locals as well. And we all have a lot to learn from this. And I have submitted a bill to Congress along with my colleague and good friend, Stephanie Murphy, from the Democratic side of the aisle, to form a 9/11 commission, type commission after this is all over, to look back and see what we can do better next time. It is easy to criticize, but now I think, as you acknowledge, there's a lot of learning that you did on the job, and I think everyone has from the top down. And with that, I yield back. Thank you.
Thank you very much. Chair recognizes gentleman from Louisiana, Mr. Richmond, for 5 minutes.
Thank you, Mr. Chairman. And I guess following the gentleman from New York, I will, in a minute, call BS when I think I hear BS. Let me start with thanking you for your holding this hearing and your patience. I mean, my colleague from Louisiana, Mr. Higgins, talked about how important it was for people to actually be in the room and be there so that we could have this hearing, as he asked to skip the order so that he could go catch a flight and leave the hearing. So I just want to make sure that while we're having this call, that we're honest. This issue is far too important to the American people to simply politicize it or play defense. Mr. Katko mentioned that learning is important in this role. And I agree with him 100%. But I also would say that accurate information to the American people is very important. And with that, let me just ask one basic question to all of the witnesses. Do you all agree that wearing a mask is a basic tool to containing and beating the coronavirus? Could you answer with a yes or no, please?
Yes.
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 Hearing that we're in unanimous agreement, I think that it is, unfortunately, if we're going to talk about learning, I want to make sure that all my colleagues understand how important it is. My colleague who left the hearing early in his area said, what you're wearing is a bacteria trap. It's not helping your health or anybody else's. That's not learning. That's not accurate information. That's Mr. Higgins' quote. His next quote was, wearing a mask was dehumanization of God's children. And I just want to say that the biggest rise right now in Louisiana in terms of coronavirus spreading is in Mr. Higgins' district. And I use that not to pick on Mr. Higgins, but to highlight that accurate information to people in this country and leading by example is one of the ways that we are going to defeat COVID-19 and save lives, not Republican lives, not Democratic lives, not Black lives, not white lives, but that's how we're going to save the lives of people. And I think that that is very important. Mr. Shelton, let me ask you a question. You mentioned the essential workers, and I want to talk about that. Let's take your public transit bus drivers or any of your essential workers. Are any of them getting hazard pay?
Well, we have Congressman, thank you. We have an emergency plan here for workers that we get time and a half, everybody that was with the city. Our state enacted a policy to allow us to put people on administrative leave. So in Tupelo, we utilized those policies so that every city worker in the city of Tupelo received their salary, and then those that worked during the emergency got time and a half. The more specific towards transportation, though, that's actually something that is in very real danger of getting cut altogether from the budget cuts. We've already cut over $2.5 million from our budget. We've got budget time coming up. Our municipal budgets have to be finished by September 15th, and our municipal transportation system very well could not survive this year's round of budgets due to lack of funding.
What about those city services that you may contract out? I mean, in some places they contract out through labor or staffing their bus drivers or their sanitation or their hoppers. How are you providing hazard pay for bus drivers or others that may be privatized?
Well, our transportation system is contracted out, so that's private. Our waste collection is private through waste management. So those, as other than City of Tupelo maintaining our payments, those companies are responsible for making sure the employees get paid. Now, some of them, my understanding, have taken advantage of some of the unemployment benefits through the CARES Act. There are a lot of great benefits that have helped a lot of people. And I, again, want to thank this body for passing that. But that's been a challenge.
And since I'm about to be out of time, but the HEROES Act would allow us to send you substantial sums so that you could provide hazard pay for your city employees, but also make sure that those who are providing city services would have the ability to receive some sort of hazard pay also and protect them.
That's absolutely correct, Congressman. Thank you. And the HEROES Act would be a huge help to local governments all across the United States of America.
Thank you. And with that, Mr. Chairman, I yield back.
Thank you very much. Chair recognizes young lady from Arizona, Ms. Lesko, for 5 minutes.
Thank you, Mr. Chairman, and it's good to see the other members, if not in person, virtually. Governor Pritzker, I have a question for you. You had said somewhere along this testimony that you wanted to thank all of the Congress members that voted for the HEROES Act. In the HEROES Act, there was a provision that released federal prisoners 50 years old and older, no matter what type of crime they had committed. And it also financially incentivized states to do the same. In a letter that our office received against a bill that was included in the HEROES Act, it says, we are incredibly concerned, and this came from an organization called Rights for Girls, which is an organization that protects girls and women from sexual trafficking, sex trafficking, and violence. And it says, we have been contacted by survivors from several states that are extremely distressed about the widespread release of people from prisons, including those with histories of sexual violence, sex trafficking, and child sex offenses. Do you support that provision of the HEROES Act as well?
Well, I haven't read that provision, but I can tell you that here in Illinois, and we've been very careful looking at our prisons to make sure that any releases that have been done, and there have been some, have been people who've committed nonviolent offenses, people that were near the end of their term, their sentence, and indeed making sure that we're doing the best that we can to keep COVID-19 away from the staff, the officials that work at our prisons, as well as the prisoners themselves. You know as well as I do that the congregate settings in every circumstance, and it's certainly true in prisons, are just petri dishes potentially for COVID-19. So we've done as much as we could, but I'm unaware of the
I have to ask the next question just because I have a limited period of time if I didn't. But at least it sounds like you're making some common sense decisions about not releasing just anybody and everybody. The next question I have is in the HEROES Act, it actually would allow or have the IRS pay illegal aliens $1,200 in those relief payments. Do you support that provision of the HEROES Act as well?
Look, we have undocumented residents in the state of Illinois, and it's important for us to make sure that they are supported in some fashion, that they're not starving, that they're people who can survive, and so we're supporting them at the state level, and we certainly would appreciate support from the federal level.
All right, thank you, Mr. Governor. Also, Mr. Governor, you had said in your testimony today that we need a national masking mandate. I don't know about Illinois, and I'm going to ask you about Illinois, but in Arizona, there's some portions of the state of Arizona, some rural areas that don't have any cases. So in Illinois, I assume it's the same. Do you think that even if an area has no cases at all, that you should mandate people wearing masks if there's nothing happening in that area?
I do, and here's why. This disease, this infection knows no boundaries. The fact is that people in our rural areas in southern Illinois, for example, we have an infection rate, a positivity rate that is now roughly the same as the positivity rate in the city of Chicago. So this can go anywhere.
Thank you, Mr. Governor. And so then, since you want this top-down mandate on masks, would you also agree that we should have a top-down national mandate on the violence, that's the gun violence, the shootings of residents against residents in Chicago? Should the national government come in and do something about that as well, instead of the local and the state?
Actually, the federal government does provide some funding to help us fight violence, and we use that.
Should it be a mandate as with the masks from the national level down?
Well, I do think the federal government should provide violence prevention funding and helping us to deal with the violence that exists in cities all across the nation. Yes.
Thank you, Mr. Governor. I wasn't asking about funding. I was asking about a mandate, like the mandate that you want on mask wearing. And so with that, I will yield back. Thank you.
Thank you very much. Chair recognizes the gentlelady from New York, Ms. Rice, for 5 minutes.
Thank you, Mr. Chairman. I'd just like to throw out to all of the witnesses, we are, in my district, school districts work independently, and they are each coming up with a plan as to how they're going to reopen schools. The mayor of New York City just said that New York City school kids will be coming back very likely 2 or 3 days a week with a severely reduced class size. We have already seen how difficult it is for kids to get a quality education when they're learning from home for a whole host of reasons. And I just start with the governor and then go through everyone else. how are you looking at reopening the schools? Has that decision been made yet in your state? And are you following the CDC? You know, the president came out today and basically said that don't listen to the CDC because their guidelines are ridiculously restrictive, whatever that means. And he has said now that we should all wait for guidance to come directly from the White House. I don't know what he's going to base that guidance on, but if it's not on the CDC, I really don't know what value it's going to have. So, Governor, if I could start with you and then just go through everyone else, that would be great.
Sure. Well, I think if the president really wanted schools to be open, he wouldn't have just said it. He would have put forward a plan. But here in Illinois, our Board of Education, in fact, did put forward a plan. And it's a plan that takes into account that there are differences between the more rural areas of our state, the suburban and the urban areas, and allows the local school districts to adjust how they would reopen. There are areas where it will be difficult to bus everybody in a rural area to the school because there are only so many school buses, and we can't have the school buses packed with kids in the morning going into school and packed with kids going home. And so, we've got to make sure that we've got shifts, let's say, or that kids are perhaps coming in on alternate days. Remember, we're also trying to save the lives of and the health of the people who work at the schools, our teachers, our paraprofessionals. And so, this is a challenge. There's no doubt about it. And we're watching our metrics very closely so that we can make adjustments. And we'll be making decisions along the way here. But as for now, we've provided at least guidance for school districts about how they should open.
Does anyone else have any thoughts on that?
Yes, thank you, Congresswoman. We've known since this pandemic started in March, or before March, got to the country in January, we've known that that we're going to have to open schools in the fall. And the president, contradicting CDC today is part of what I said, what I was alluding to in my opening statement in my submitted documents, that exacerbates the problems that local officials are having. When I issue an executive order here, and then the president, my executive order is based on CDC recommendations, and then the president gets on Twitter and says, don't believe that. Well, the president's passionate supporters are going to listen to the president and not the CDC. And that complicates the ability of government at every single level to be able to respond to COVID-19. As far as our school district here in Tupelo, it's like you mentioned, a separate school district. They have a plan to reopen in August, but they're kind of going day to day, seeing how the situation continues to unfold. The cases continue to rise here.
Congresswoman, here in Texas, from a public health perspective, Texas Education Association had just yesterday put out some guidelines related to how schools will reopen here in Texas. We had been working with some of our school districts prior to this, and I think the concerns that individuals have is what you've just heard from the governor and the mayor, which is really about not just protecting the students, but also protecting the staff and any visitors that are coming in. It's the entire group of individuals that need to be protected. And so there are concerns that schools have related to that safety piece. Obviously, we have an increase in cases, and we have increase in concern and worry in our community as well as across Texas. So I don't believe it's been worked out, but I will tell you that those guidelines are being looked at very closely, not just at the state level, but at the local level, not just in the education system, but also in the public health system. And the concern is to make sure that we have an approach that, again, is common sense driven, that we want to make sure it's also based on evidence and science, but it also assures the safety and health of everyone involved. And that also may mean that a hybrid approach of in-person, in addition to obviously virtual, that some of those approaches need to be part of it.
Colonel Hastings?
Thank you, ma'am. In Alabama, I'm not the superintendent of schools, but I know that Dr. Eric Mackey has been in close coordination with Dr. Scott Harris, our public health officer. And they put forth a roadmap to open schools that I thought was very reasonable, followed CDC guidelines and public health orders. But ultimately, like in your state, ma'am, here in Alabama, it will be a local decision of how the schools open, because we are a diverse tapestry of 67 counties and a tribe of a multitude of personalities, cultures, and a way of living. And you can't mandate from a central point down and have it work. So I feel like there's enough information out there for our local superintendents and principals to find that happy medium to make parents feel safe, children feel safe, faculty feel safe, and to make sure that children coming together in close quarters, you really need to be careful, because they may be the perfect vector of this disease, and then they bring it back to Alabama. And in Alabama, especially in rural Alabama, we have multi-generational homes. So that is all going into this, and how we use the CARES Act money given to the school districts, and then allowing the counties to partner to operate in a way that is good for them.
Thank you all very much. And thank you, Mr. Chairman. I yield back.
Mr. Chairman, this is Mike Rogers. Can you hear me?
Ranking member, go ahead.
Yes, sir. I just wanted to make sure you were aware that we're having a problem with the public feed. None of Ms. Lesko's and most of Ms. Rice's testimony was not seen. They were looping Cedric Richmond's questioning repeatedly, but it's back up now. But just wanted you to be aware there is a problem.
Well, and I think we were about to recess to create the ability to go online again. Our YouTube channel is down. So thank you, Mr. Ranking Member. And we'll recess shortly and reconvene subject to the call of the chair.
Mr. Chair, this is Congresswoman Lesko. I have a question. Mr. Chair, I just want to know if, because I have another appointment I need to go to, if I have to re-ask my questions, or are the questions recorded and the answers that the governor gave, so you can rebroadcast them later?
Well, I can't give you that question yet. I'll talk to the technical people. If we can, we'll do that. Other than that, if you can submit it in writing, I'm sure we can get it. But the technicians are working on the problem right now. We'll recess subject to the call of the chair. for questioning, since Mr. Crenshaw is not available. If he comes, according to the rules, we'll just go back. So the gentleman will be recognized for 5 minutes for questions.
Thank you, Mr. Chairman. Can you hear me?
Yes.
Thank you, sir. Governor Pritzker, I was struck by the certitude of your criticism of the administration's efforts. I was just looking on the Worldometer's website, and it appears to me that in terms of the experience measured by deaths per million during the pandemic, a number of nations have had worse experience than the United States. Of the larger ones, the United Kingdom, Spain, Italy, Sweden, and France have all suffered worse results. Do you believe that those nations also have had a failed response, national response?
Look, what I can tell you is that a lot of promises were made to the states, including to us, that were not delivered upon. And that's what I was really referring to. I'm not comparing us to other nations specifically. I'm just saying the federal government, the White House in particular, had made promises about the delivery of PPE, about testing supplies, had the capability to allow the CDC to give us more guidance, and really, very little of that was delivered.
One of the things that has gained a lot of currency, and the president refers to it a lot, is his early decision to cut off entries from China, other than U.S. nationals. Do you concur? A lot of Democrats criticize that. Do you concur that the president made the right decision in that regard?
Well, I think we all are seeing now that travel by people who may be infected is something that everybody's paying attention to, and that limiting that by people who again come from areas that have significant infection rates is important. So I have not been somebody who's talked about that. What I have talked about, though, is the way in which that was done. We had a problem on the days in which the president just decided and announced it. Really nothing was done to help airports deal with the problems of all the incoming international passengers from those places. Many people were desperate to get back to the United States who may have been U.S. citizens living in places like China or in Europe.
Thank you, Governor.
And so at O'Hare, just say we had an overrun of people. It was a real problem, packed into it.
Let me change subjects just a bit. You were particularly critical on the PPE thing, and you made reference to that again. I guess Illinois maintains a stockpile of PPE. Is that correct?
That's right. We had a stockpile to begin with.
Why didn't you have bigger stockpiles?
Well, look, I can't answer that question because those stockpiles were put in place before I became governor. But what I can say is, and I think I heard one of the other panelists talk about, that there were leftover stockpiles from H1N1 that had expired, that had to be, re-upped and allowed.
Suffice to say that if you had larger stockpiles, or any state had larger stockpiles of its own public health supplies, they might be less inclined to cast blame or find blame with the federal government for the amount of its stockpile. Fair to say?
Well, I would say this is certainly an unprecedented pandemic, but I would also say that the Defense Production Act wasn't really a criticism that we didn't have the stockpile at the federal level. It was that we could immediately have invoked the Defense Production Act in order to help us rebuild those stockpiles.
Well, let me ask you about that. So, I mean, what that would assume is that by taking command control of the economy for producing PPE, we would produce more and faster and get them distributed to the right place than leaving existing economic actors in place. Is that what you believe? And do you have any evidence to support that would have been better?
Well, the existing economic actors were not prioritizing PPE to the places that were needed in this pandemic. It was the states and local governments and emergency management personnel and health officials that knew
and hospitals
PPE needed,
right?
And hospitals too. And so my point is that we weren't getting that PPE from the federal government, and what we needed was we needed the federal government to organize the market to direct those resources so that we could use them to save lives.
What is to say that in the context of a 2-month period of time or 3-month period of time, the federal government taking over that market with a command and control structure would have produced more and in the right place than allowing the market to function, with augmentation of efforts from the federal government, such as FEMA directing resources as it did?
Well,
The
look at
basis for your confidence to that effect.
Right. Well, look at what happened with the air bridge. You know, the distributors who received the items through the air bridge distributed them again, not based upon where the need was, but based upon where their customers were, you know, who they had as historic customers, not where what the need was right at that moment. That's precisely what Defense Production Act invocation would have allowed the federal government to do, to direct the resources where they were needed. Remember, New York, California, other states that had an immediate rise in cases, PPE could have gone directly to those places immediately, to Chicago and to Illinois where we needed it. And of course, we knew where the hotspots were. So again, having some direction from the federal government would really have helped.
Thank you, Mr. Chairman. My time has expired and I yield.
Thank you very much. Chair recognizes the gentleman from New Jersey, Mr. Payne, for 5 minutes.
Thank you, Mr. Chairman, and I'd like to thank the witnesses for being here. Governor Pritzker, uh, Illinois is like my home state of New Jersey, has made serious progress in combating the spread of coronavirus. Although, you know, we still both have a long way to go. At a time when much of the national attention is focused on new hotspots such as Florida, Texas, and Arizona, are you getting everything you need from FEMA to continue the fight against the COVID-19 and ensure that the recent gains are not short-lived?
Well, thank you, Congressman Payne. And let me first congratulate you on your victory yesterday. I happened to have spoken with your governor last night to get his advice on a matter or two. And let me just say that look, we need more help. There's no doubt about it. You know, we're trying to expand, desperately trying to expand our testing in the state of Illinois. We think that's a hugely important thing. We've made a lot of progress on it. But the federal government, once again, can be more help to us in that process. They were, by the way, along the way, not at the beginning, but by May, the federal government was, in fact, sending us swabs, which was something that we needed desperately. I think we're needed around the country. There's so much more that's needed, though. Let me just, go back to something I said in my remarks, which is remember that our state and local governments, because there is a failure of revenues as a result of COVID-19, are going to be faced with massive layoffs for first responders, for the basic services that people need across our state and across our nation. And without those resources, I mean, what we've seen as a healthcare crisis where we've had to put a lot of dollars into public health is, of course, now also become a financial and economic crisis. We don't want it to be exacerbated by having state and local governments make massive cuts to the very services that at this critical moment people really need. So I would just say that if I had to name, among the things that I've talked about, one of the most important things is making sure that our state and local governments can do what they need to do during this terrible crisis, because it's not over. And it's not ending in the next couple of months. We need to see a very effective treatment or a vaccine before we can get beyond this.
Absolutely. And, to the point about the federal government, in the HEROES Act, we tried to address that with the aid to state and local governments, but it's sitting over there in the Senate with the other 600 bills that we've passed over this Congress. So, maybe one day they'll decide to pick them up and take a look at them while the American people languish with this dreaded disease. And I tend to agree with you. This administration has been less than desirable in their attitude in reference to this. FEMA has done the best they can, but they are at the behest of the president and the vice president. And, it's unfortunate that they aren't allowed to do what they need. They know what to do. It's being allowed to do it. And going in and helping different locales fight this disease. Now we see what's happening in Florida and Texas and Arizona, but there was no problem. It was going away. And, if we're not careful, we'll see the same situation back in our states. And so, And the president of the Senate's attitude is, well, pull yourself up by your bootstrap, except in Kentucky, where he's making sure they have everything. So it's just unfortunate that the administration has taken that attitude. And Dr. Shaw, I'm pleased to see you here today. I appreciate you. You gave excellent testimony back in October last year at my subcommittee hearing on bioterrorism preparedness. And I see the massive resurgence of COVID-19 this summer as a disturbing trend. Dr. Shaw, what do you think will happen in the winter when the flu season will return? What do we need to be doing to prepare?
Thank you, Congressman, and good to see you again. And thank you for reminding of the pre-COVID hearing last year, which seems ages ago.
Yeah.
On your previous question, I did want to make a comment that public health has seen over 56,000 jobs that have been lost over the decade, and that is really concerning to me from a public health standpoint across the nation. We have taxed the public health system so much that very well we are going to see markedly more diversions and folks leaving the public health workforce, which is a real concern of ours. In the fall, to your question, the real concern that we have is that we are still not through, as Dr. Fauci said, this first wave. And now in just a couple of months, we're going to very much be in the midst of flu season. And while we're in the midst of a summer, if you will, usual respite from flu, now flu is going to come back in the midst of fall season. We also have concerns about people not taking flu vaccine because of concerns, misguided though they are, around anti-vaccination, that there is really a concern that people are not going to be vaccinated. And number two, that you're going to have a vengeance when you have both flu and COVID that are intermixed together in the fall. And that is a concern of all of ours in public health.
Thank you. And I don't know if my time is.
Gentleman's time has expired.
Thank you, sir.
I know you're celebrating yesterday, but we have some other members.
I yield back, sir. I'm sorry.
That's all right. We now recognize a gentleman from Texas for 5 minutes, Mr. Crenshaw.
Thank you, Mr. Chairman, and thank you, Dr. Shaw. It's good to see you as always. You mentioned Harris County's history of responding to crises and disasters. You have a lot of history being on the front lines, doing so. We appreciate that. How does this federal response to COVID relate to the past disasters that Houston has seen?
First of all, Congressman, great to see you, and thank you for your continued support. Really appreciate it. I think there are a couple things I would say. One is about the disaster itself. This is not a hurricane in one spot. This is throughout the country, throughout the globe. All communities across the world are going through this differentially. So there is this massive nature of this. But the piece that is of concern to me is that in the past, when we've had these disasters, these emergencies, we have actually seen CDC oftentimes be that leading voice and actually convening behind the scenes a lot of discussions with state and local health officials that allows us to learn from each other. That has not happened as much as I have seen in the past. And I've got a lot more to say, but I think let me pause there because I know you have more questions.
Yeah, no, I do, and that's a reasonable concern to have. And I appreciate your candid and honest response, because what I've heard from the main hearing, the tone of this hearing, you would think we live in a totally different world than what actually happened. And I won't dwell on the dishonesty that I've heard from others, but I appreciate your honesty on this. I think we're on the same page. When we met in my office in early March, you focused on the fact that we had public health issues other than COVID, and that COVID could negatively affect those ongoing issues too. There are other public policy goals, as it turns out: education, jobs, other health issues. What was the result of the lockdown on these other public health issues?
Well, thank you again for that. As you know, that it is not just health and medical impacts from COVID. It's this real socioeconomic, sociodemographic impact across the communities. And so it has, obviously it's too early for us to have specific numbers to say what was the impact on education or the economy all throughout. I will say this, that we know that there have been secondary impacts, and while they have not been quantifiable, we also know that education, jobs, et cetera, also have secondary impact on health, and vice versa. They all work together. And so, I do want to make sure that we recognize that we have to really make sure this is not an either or, that we're only looking at health. We should be looking at all of those aspects together. It's an and as we continue to fight this pandemic.
As you state, I mean, dealing with this, it's a science and an art. Some people say, well, just listen to the science. Well, science disagrees on a lot of things, and there's judgments that have to occur, weighing costs and benefits and weighing other issues, like you just mentioned. There's also been a lot of debate over reopening the economy. Now, Texas reopened in early May. Places like California, which is seeing spikes just as bad as Texas, even though nobody likes to mention that. I wonder why. They opened up a lot slower, and they were locked down much more severely. But both saw spikes. So can you expand on what you talked about with the layering effects that you mentioned that may have caused the spike that we're seeing across the country?
Yeah, this virus is an equal opportunity virus. It does not respect seasons. It does not respect who you are, how you are, what you're trying to do in life. At the end of the day, if you are exposed, there is this real concern that the exposure can lead to infectivity. And I think that is the critical piece. The layering effect, in my mind, is very important. It's not just reopening. I can't quantify exactly how much because no one can. It's not just reopening restaurants at 25%, then 50, then 75, or bars or gyms and back and forth. But what it is that you have layering effect in addition to these milestone events like, as I mentioned, Mother's Day and holidays and protests. And now we've had Father's Day, and now you have graduations in between. Now we've had 4th of July. All of that layers upon each other. When you dial something up or you have an event, it generally takes a few weeks for you to see the impact. And just conversely, when you dial down, it takes a few weeks for you to see the impact. It is not immediate. But the concern we have in our community, as you know, is that what's happening in our healthcare system is that we cannot wait for this runway because there is limited runway in that healthcare system. And that's why we're concerned about making public policy decisions that can really interrupt this transmission now.
Thank you. I'm out of time. I have a lot more to say, but thank you, Mr. Chairman. I yield back.
Thank you very much. Chair recognizes the gentlelady from Illinois, Ms. Underwood, for 5 minutes.
Well, thank you, Mr. Chairman. What a treat it is to have our governor with us on the line today. He certainly has made us quite proud throughout this response, and I have a series of questions for him. I would like to begin. Governor, your background's in education, and I'm sure you'd agree that returning to school is integral to the well-being and development of our children, as well as to working parents, and to the long-term health of our economy. But it's essential to make sure that reopening schools does not place students, teachers, and their families in danger. States and schools should be able to count on the federal government for guidance during a crisis of this scale. So as you prepare to safely reopen Illinois schools, what information, expertise, and resources do you need from the federal government?
Well, thank you, Congresswoman. And I want to just begin by saying thank you for your very strong advocacy for the state of Illinois in Washington, and especially for your advocacy in helping us get through this pandemic with everything that we may need. I know you're fighting for us there, and I really appreciate that. And in answer to your question, this is a very complex challenge, getting our kids back to school and doing it safely. We didn't do this starting out with the idea that, well, we have to get everybody back to school. We started with the idea is, does the science and the data allow us to send kids back to school? And if so, in what manner? And how would that work, especially when we know that we need to watch our distance. We need to make sure people are wearing masks or face coverings, and all the challenges of people with preconditions that that the adults and the children who are going to be in that school. Not to mention, and people don't really mention this much, the parents who interact with the school. So, that's been the challenge. And what we did to begin with was we got our health professionals, and this is how we've done all of the facets of reopening and restoration that we've done. We got the public health officials together with the people who know our schools best, all across the state. And again, we have very different school districts in rural Illinois than we do in suburban and in the city of Chicago, for example. But we got them together and made sure that the ideas that were being put forward were, number one, going to keep our kids and everybody at the school healthy and safe. And number two, were feasible. Number three, what investments do we need to make make sure that we can get those accomplished? And so long story short is the federal government guidance is so vitally important from the CDC. I hate to say that I've often found the CDC as being muzzled along the way here. I think the CDC is what we should be relying upon. There are a lot of terrific epidemiologists and expertise that exists at the CDC, but often what we found is either they put out guidance and then the White House tells them, no, we're pulling it back.
That's right.
Or they're beginning to put out guidance and someone says, you're not allowed to talk. So we're very concerned about that fact. So I feel very fortunate that I come from a state where we've got some terrific world-renowned scientists, epidemiologists, researchers, and so on. So we've been able to rely a lot on our local capability that really is world-class. But I wish that we could have a federal government that was our partner in this endeavor. It's why I was so frustrated to see the president just sort of pronounce that, well, everybody should open their schools. Well, great. Please provide us with the kind of guidance that will help us do that.
Yep. And I'm certainly concerned about their announcements today from the Department of Education, for example. We have a minute left, sir. So I know that the state budgets across the country have been devastated by the pandemic. And nearly 2 months ago, the House passed a bill, the HEROES Act, that would provide $500 billion in relief funds to state governments, including almost $18 billion for the state of Illinois. Unfortunately, the Senate hasn't acted on the bill. So for the benefits of our colleagues in the Senate, what impact would this funding have on our state of Illinois?
Well, before I say that, I just want to say that I talk to Republican, Democratic governors all the time, all across the nation. So when I answer your question, I'm partly answering what I think Republican and Democratic governors across the country are saying, which is without that funding, imagine how difficult it will be to reopen schools and to provide the resources that we need for schools, not to mention our public health infrastructure, which is funded by state government. Our city, county governments provide our firefighters and our police officers and public safety. They're already making layoffs, the significant layoffs. We can't afford to have that happen across the country in the middle of a pandemic. And if you can spend, trillions of dollars helping large corporations survive, $500 million to support state and local governments, which provide such vital resources for our residents, I would say is a small price to pay for what's absolutely necessary here.
Well, Governor Pritzker, thank you for your leadership. Thank you for being with us today. And Mr. Chairman, I yield back.
Thank you very much. Chair recognizes the gentleman from Pennsylvania for 5 minutes, Mr. Joyce.
Let's start again. Thank you. Chairman, thank you for yielding and thank you for convening this hearing. Although I am disappointed that we're not all here together to conduct this important committee business in person. I would like to thank my colleague, Ranking Member Rogers, for his leadership in gathering us here today. I would also like to thank our panel of witnesses for appearing today. The COVID-19 pandemic has started a crisis unlike anything we have seen in our lifetimes, and certainly unlike anything I have seen in practicing medicine for over 25 years. As we have seen this virus progress, it has disproportionately impacted elderly patients, especially those living in nursing home or other long-term care facilities. In my home state of Pennsylvania, this problem was tragically increased by a misguided order from our governor to readmit COVID-19 positive residents back into nursing homes. This order flew in the face of common sense and guidance from the Center for Medicare and Medicaid Services issued just days before. I would strongly urge this committee and the entire House of Representatives as a body to look into this order and similar orders given in New York, Michigan, California, to take full account of these deadly mistakes. As we continue to face this virus, we cannot forget where it originated. Chinese obstruction and outright lies to the media and to international investigators are at the root cause of this virus, and it allowed it to spread onto a global scale. It remains critical that we are vigilant to the threat from China and act together as a committee to respond to any increased cyber attacks or other threats to our homeland while we continue to fight this coronavirus. Director Hastings, thank you for appearing today. In your testimony, you mentioned how quickly you were able to receive major disaster declarations from the Trump administration. I'm pleased to report we had similar success in my home state of Pennsylvania, and our delegation was able to support the requests from our governor in a bipartisan manner. It is also my understanding that the Trump administration was able to approve similar declarations very quickly for states all across the country. Director Hastings, could you please elaborate on any additional resources that Congress might need to make available to help states like Alabama be successful in their continued fight against COVID-19?
Thank you, Congressman. I think in my written testimony, I talked a little bit about the CARES Act. One of the things that we're concerned about, and I was going to get ready to pull the Region 4 state directors, is the interpretation of whether the CARES Act funding can be used for both the activities that any emergency management agency does, because we're not considered public safety agents. So that's one. Two, we also got really quick approval working through the Alabama Department of Commerce through the Small Business Administration to get a SBA disaster declaration. And the blessing and the curse of being in Region 4 is that we are disaster prone. So I enjoy a great relationship with our sister states and also with FEMA Region 4. But I think the biggest thing is that the national emergency right now ends on 31 December. And I'm not a public health officer, epidemiologist, or an a pathologist, but I just don't see COVID-19 going away at the new year. So I think we need to batten down the hatches for a long fight and really start to look at the habits we have today, the things we need to do, kind of reinvent the way we do things to deliver services to our people in inventive, agile, and innovative manners. Because I don't believe we're going to go back to normal. I think we need to go forward to better. And I don't know what forward to better is yet. And I agree with the governor of Illinois is that we're exploring, deciding, making mistakes, learning from them along the way. And if we can continue to share those things with the federal government, our states, in a more collaborative, cooperative manner, I think we'll be better as a nation, as regions, and things like that. But I just don't think the need and the assistance from the federal government will end on the 31st of December. So that's one thing I'm a little bit concerned about.
Thank you for your hard work. Thank you for your dedication to Alabama and to our country. Thank you for your insight. Mr. Chairman, I yield the remainder of my time.
Thank you very much. Chair recognizes the gentleman from Texas, Mr. Green, for 5 minutes.
Thank you, Mr. Chairman, and thank the witnesses for appearing. I'm also very grateful to the ranking member for his role that he has played in the process. If I may, I'd like to refer to some empirical evidence and then ask a question. This is intelligence that relates to new cases as of 7/7/2020, new cases of coronavirus, I might add. In Texas, on 7/7/2020, a state with 29 million people, we had 10,028 cases. Like to juxtapose Texas to Canada. Canada, population of 37 million, decidedly more than Texas, had 172 cases. Texas, 10,000, Canada, 172. This makes it intuitively obvious that we can do better. And I can't believe that the Canadians know more about the virus than we do. I can't believe that they have better medical facilities than we have. So there must be other things that are giving them the opportunity to have 172 cases on yesterday, and Texas 10,028. Dr. Shah, my dear friend, I'd like for you to comment on this, if you would. The rationale for Canada being so successful as opposed to my state that I love dearly, and I assume you love dearly as well as a resident.
Well, thank you, Congressman. Always to see you and your support, leadership. And yes, I came to Texas because I do too love this state. I will tell you that this is the concern that we have. When you say that there are 10,000 new cases that are being, deemed positive on a single day, and then you compare it to our neighbors at the north, and it's markedly less than that, then that means that we as a nation have to do markedly better. And it's not about the politics, it's about the policies. It's not about the red or the blue, it's about all of us working together. We just had 4th of July, and that means that we should be coming together as a nation because we are well beyond and behind the 8 ball when it comes to fighting this pandemic. And that concerns us across the country. That concerns us in Texas. That certainly should concern us here locally. So I agree with you, and that is the concern that we have. I do think it's about that inconsistent messaging, and it's also about having the strategy that really allows us to continue to assure that everyone understands their role and everybody is working together. That's what we're not seeing.
Thank you. Colonel, if I may, I have had the opportunity to look at your record. You have served your country well, and I compliment you. I have to ask you a question. I'm a member of several fraternities. If my fraternity wanted to come to your state, say 6,000 strong, and we wanted to have a convention within a facility, not without, would you recommend that we have this in-person convention indoors, 6,000 strong?
Congressman, my recommendation would be based on our current Safer at Home guideline and campaign that the governor has and the public health orders that are currently applicable in Alabama. So it does recommend that large gatherings where you can't have social distancing are not recommended. So if someone was asking for my recommendation, I would not recommend that as part of the Unified Command, as the Director of Alabama Emergency Management, and as a supporting partner with Alabama Public Health on behalf of the strategy that Governor Ivey has in place right now.
Dr. Shah, if you would you kindly respond to the example that I've accorded?
I would agree that just as you just heard from Mr. Hastings, we are very concerned about any time you bring people together for any reason, regardless of why people may be passionate about it. That concern from a public health standpoint increases risk. You certainly don't want to do it in any community where you have increasing numbers of cases or tests that are coming back positive or hospitalizations, for example, in ours.
would it make a difference if all of us were of a given political persuasion? We were all a part of one political group, if you will, a party perhaps. Would that make a difference?
From a public health standpoint, no.
Thank you, Mr. Chairman.
Thank you very much. Governor, I got your message that you're going to have to depart. Let me thank you very much for the time you've given us. And I know you'll stay as long as you can, but thank you very much on behalf of the ranking member and myself for being a witness for our committee.
Thank you very much, Mr. Chairman and Congressman Rogers.
Thank you. Chair recognizes the gentleman from California, Mr. Correa, for 5 minutes.
Thank you, Mr. Chairman, for holding this most important hearing, and our ranking member as well. Thank you very much. And I want to thank our guests today for being here. I wish the governor would stayed on for 3 more minutes. I did have a question for all of you, and I still do. I represent Central Orange County here in California. 90% of our industry here, of our jobs, are dependent on tourism. Our biggest employer here is Disneyland. 95% of my constituents that work in the entertainment, hotels, restaurant business have been out of jobs for months now. And as we have these economic stimulus packages that we in Washington have rolled out, as those come to an end, you're going to see people begin to hurt in a very serious manner. Every weekend, I'm out giving food baskets, food to my constituents, folks driving in with nice cars that have not had a paycheck in weeks. And as I'm listening to your testimony, and all of you, some of you mentioned that this morning or last night, the president came out and contradicted the CDC. I'm also trying to figure out as Americans, where do we turn to? What do we do to get a unified message, unify us and say, we got to move student body left or student body right, pick a play and execute, as opposed to being contradictory as to what we're supposed to do. So I'm going to ask the Mayor Shelton, Dr. Shah, and Colonel Hastings, what's the message out there for my constituents? We're a Democratic district, but you know what? We have a lot of my constituents that also follow the president's message very carefully. What do we say to our constituents? And in the context of getting our country back in order, making sure that folks are able to go back to work, but we've got to get this COVID-19 under control. What do we tell our constituents? Dr. Shah.
Well, this is, thank you, Congressman, and this is exactly what I said about the inconsistent messaging. It creates confusion and even complacency, and unfortunately, it actually means that people take risks. You don't know exactly who's right or wrong, and they may make a decision to take a risk. And from a health standpoint, that is a terrible way to make decisions. Terrible. Because what it does is at the end of the day, we now increase transmission and exposure, and that cooks upon each other. And the next thing you know, you have increases in cases. And so,
Colonel Hastings, I've got 2 minutes. Go ahead, answer the question.
Well, we have an Alabama strategy and a grand strategy and phases of our state operations, and we want to make sure that everyone's behind that. But I think to what the doctor was saying is that it's not in a digital world. This is not a binary answer. It's very analog. You can open the economy, but you have to comply with public health orders and CDC guidelines. You can open the economy, but when you close down your schools, you got to figure out how do you deliver school to the children if the children can't come to you like we did, or if we close down businesses or services, instead of people coming and congregating, how do those people deliver those services to the people? So where, yes, people are going to be suffering, and on July 31st, I am concerned about maybe a looming humanitarian crisis. This time that we have right now, we need to take a step back take a deep breath and go, how do we reinvent the way we do business? How do we reinvent how we connect with people?
How do
And
we get
I
that
think we can do.
unified message? How do we get that unified message?
Well, in Alabama, our strategy is mobilize Alabama for a whole of society response to slow the transmission of coronavirus to a level commensurate with our medical system's capacity to care for our citizens in order to buy time to find a vaccination or treatment.
Thank you, Colonel Hastings. In my last 30 seconds, Mr. Mayor Shelton, tell me.
The President of the United States needs to get on TV and have a call to unity, that he needs to dispel the conspiracy theories and the rumors that are hampering the efforts of government on all levels to respond. And we need both parties in the House and Senate to continue to work on legislation that's going to get help where help is needed.
Thank you very much, gentlemen. And Mr. Chairman, I yield. You're muted, sir.
Chair recognizes the gentleman from Kansas City, Mr. Cleveland.
Thank you, Mr. Chairman. One of my big concerns is, we politicize everything, and we have things like your seat belts, which is required to be in automobiles, and I guess motorcycle helmets. To a lesser degree, they may be regulated by churches, but it's become a if you support the president, you don't do this, and I'm so concerned about it because I think we're probably going to lose some lives over that, and may have already done so. But Dr. Shah, I'm one of the things that I'm talking about is in my birth state of Texas. We have this contagion running rampant in Texas, and can we say to people in Texas, I have about 100, maybe probably more that I just don't know about, but at least 100 of my family members live in Texas now, and if I were to talk to them, can I tell them with any degree of accuracy that everybody in Texas who wants to take the test can take the test?
That's thank you, Congressman, and great to hear from somebody who is a Texan at heart. What I would say is two things, and I've been saying this is a tale of two cities. We've gotten better with testing, but we're not where we need to be as a nation, and certainly here in Texas. And the key message that I've been saying, and people have asked me this question, if somebody wanted to get tested, could they get tested? The answer is yes, likely, should be. But if the answer is we have 5 million residents in Harris County alone, if today they said, I want to get tested today, the answer is absolutely no. So the answer is really very much about we're better than where we were, but testing is a key foundation, and we need to really spend a lot of our efforts as a nation on making sure testing capacity is even better than where it's been.
I'm also concerned. Thank you, Doctor. I'm also concerned, though, however, that the politicization has gone so wildly that I was in a meeting with some members of Congress, and I was told that even if a vaccine is created, this is a member of Congress who said, I'm not going to take it, and my family's not going to take it, and the people I know will not take it. Why would I take a vaccine? This is a member of Congress. Why would I take a vaccine that could very likely kill me? And so my question is, you deal with this stuff on an everyday basis, is that even if even if everybody can get tested, and even if we get a vaccine, we have intelligent human beings out saying openly that they're not going to take a test, and they're going to prevent their family from taking it, and all the people they know. And so if a couple of members say that, we're talking millions of people. I mean, each member of Congress represents 800,000, roughly 800,000 people. And if somebody even higher says it, woe with me. I know you can't solve that problem, but with a vaccine, I mean, how many people do you think, Doctor, die each day from taking the polio vaccine or the flu vaccine?
Well, and Congressman, I think that's the concern. That's the mixed messaging. That is the issue. That is why there are other countries that are doing better, because they have come around to the fact that we're all in this together and we have become divided. And that's the issue. The other piece that you said earlier about the testing, I will say that it's not just the quantity of tests, it's also the quality of the test, the turnaround time, the lag of the testing. It's all that together, which means that this is a very critical time for us as a nation. And unless we can get all of our efforts centered on fighting this pandemic, we are going to be in this longer, and we're going to have more unfortunate adverse outcomes.
Thank you. I took the antibody test yesterday which will have a Band-Aid here. And every time I get a chance to take a test, I'm going to take one, and I'm trying to say that to everybody else. So thanks, Doctor. This is somewhat frustrating, but thank you very much for what you do every day.
Thank you. Thank you, Congressman.
Thank you, Chairman.
Thank you very much. Chair recognizes the gentlelady from New York for 5 minutes, Ms. Clark.
Thank you very much, Mr. Chairman. I want to thank all of our witnesses for their expert testimony today. As a New Yorker, we went through the eye of the storm, being the epicenter of this pandemic. We are going through a painstaking, phased in introduction to our economy once again. But nothing is more troubling to me as a member of this committee than to see the type of spiking that we're seeing in the southern, midwestern parts of our country, particularly in southwestern part of the country, particularly because it would seem to me that we would have learned observing what New York State went through. My question is, are states actually coordinating and having conversations with one another about the experiences that each state has gone through? Because it seems to me that we're stuck in Groundhog's Day here, and this is costing lives across this nation. It would seem to me, Mr. Chairman, that there would be a coordinated effort to get a national platform, a national standard for making sure that there are PPEs for each and every state across this nation, that the stockpiles that everyone is talking about is facilitated by the federal government, and that demand would be something that we could also rally behind as members of Congress. So my question then is to the general from Alabama. What conversations are you having with similar colleagues in other states that have experienced, say, New Jersey, Connecticut, New York, that have gone through sort of the eye of the storm, if any?
Personally, I like to catch up on the national news every evening at the end of the day. And ours is kind of regionally specific, I have to admit. We have calls with HHS, ASPR, and FEMA Region 4. So among the Region 4 states, we share. And we are sensitive to what's going on in other states because as you guys are going through the eye of the storm, we were having trouble getting PPE and some resources because the nation had prioritized some of those resources towards those hotspots that initially happened. So because Alabama was kind of a slow burn with the COVID-19 rise, we were having trouble getting some of those resources, and rightfully so. They were going to places like Chicago, Detroit, Pennsylvania, Philadelphia area, New York City, and Georgia, in the hotspots in Region 4. But we have not had conversations with those northern tier states, other than through the National Emergency Management Agency giving out some documents that I go through once a week showing what all the different states are doing. And then it's up to me as an emergency manager to kind of take a look at how the nation's doing, how the region's doing, and especially how Alabama's doing, ma'am.
Well, let me follow up this question very quickly with, do you think that there are lessons to be learned as you now face this that perhaps have already been learned by other jurisdictions in other parts of the country? If this is a national pandemic, is there something that prohibits the type of conversations that would put you in a better footing to deal with what the outbreak that you're experiencing in Alabama?
No, I think there is. And I think behind the scenes, and I can't speak specifically to it, but being in the conversations with the Dr. Harris, our public health officer, and University of Alabama, Birmingham Medicine, you can hear that both hospitals and the healthcare coalitions are sharing with their partners, and they're sharing lessons learned daily with whether it's PP uses, how you flow patients in and out of healthcare hospitals and facilities. So that is going on behind the scenes.
All right, very well. My time is running down, but would like to get your take on it, Dr. Shah.
Congresswoman, thank you for that question. And I know that your state, unfortunately, has gone through a tremendous amount. I think this is exactly what I was saying earlier, where I see a role for a CDC to play across the system. I am absolutely convinced that we have to learn from each other. That's how you learn best. Unfortunately, in this emergency, we have not seen that sharing across the system except on an ad hoc basis. Not that it doesn't happen, Congresswoman, it is happening in a public health world, but it is not happening as systematically as it should happen. And unfortunately, that is also a significant driver in sometimes repeating some of those issues that we could have learned from other communities. Now, I will say that our county elected official, Judge Hidalgo, has been in touch with elected officials across the country. And I have also been in touch with health officials across the country. But I will tell you, it is not systematic on the health side as it should be and as we've seen previously. Thank you for that question.
I yield back, Mr. Chairman, and thank you for this very important hearing.
Thank you very much. Chair recognizes the gentlelady from Nevada, Ms. Titus.
Thank you very much, Mr. Chairman. It's good to see you. As I've sat here most of the morning, thank you. As I've sat here, I've heard a number of my Republican colleagues, some of whom are from some of the hottest spots in the country, grill the panel, especially the governor, in a not so subtle attempt to defend the president's actions. The witnesses have responded with answers that are informed. They are straightforward. They are based in fact, not in partisan politics. And I really want to commend them for that and thank them. I would note, though, that in the Republicans' defense of the president, I haven't heard any of them mention, defend, or ask about the president's rallies in Tulsa, at Mount Rushmore, and his future planned ones, and how they put an extra burden on first responders, hospitals, and FEMA folks. And I wonder if they believe the president when he says 99% of the cases are totally harmless, and how that misinformation plays into the mixed message that the public is getting that stymies our attempts to get over this. And I'm also just kind of curious how many of these members are going to attend their political convention next month, given all that's still going on and what's really happening in Florida. But I guess we'll wait to see about that. The question I really want to ask, though, first is to Dr. Shaw. My district is a lot like Harris County. We have a very large Hispanic population, and the numbers show that the virus is disproportionately affecting the members of that community. It's kind of easy to understand why. They work for a lot of frontline jobs. They can't take off. They're essential workers. Many of them are uninsured. Many members of the community are afraid to come forward to be tested or get information or be treated because of immigration concerns. And also, they live in densely populated neighborhoods. And even in one family, you may have extended family members or neighbors or something all living in one house. So it's fairly easy to figure out why, but I'm wondering what we can do to better serve that community, how we can better count those numbers, use that data, how local government can supplement what the federal government's having such a problem collecting. Can you tell us what y'all are doing, or maybe give us some suggestions?
Sure, Congresswoman. Thank you for that question. Thank you for your earlier comment about our answers as a collective. Some of the things that we're doing, as you know, we have a large Hispanic population here in Harris County, and we have to match the diversity of our community with our own workforce. So I think it starts there, and we have done that not just in advance of COVID-19, but also during COVID-19 with the hiring of our contact tracers. We hired 300 contact tracers by May 22nd. And the diversity in that room, I'll tell you, was incredible, including different languages. The other piece is that we have to really be making sure that as our outreach engagement efforts are in the community, that they are also Spanish speaking or bilingual, not just Spanish, but obviously in the case of Vietnamese or Mandarin Chinese, whatever that looks like, we have to be very much synced in with that. And then we really also are looking at and working with partners and media with that specific ethnicity in mind. So Spanish-speaking media or leaders that are in the Hispanic community in particular, but also the African-American community and beyond, to really make sure we have partnerships, because ultimately they don't always think about the health department as being that partner, but when there is someone in between as being a trusted source, that also helps, especially in the faith community. And there are many other strategies that I could put out there, including putting our mobile testing in those areas, and also making sure that we're doing our case investigation appropriately, and obviously ensuring that we have resources in those communities. But I think that is an excellent question, and that is something that every day we are very mindful of and responding to.
Thank you. Thank you very much. I'll yield back, Mr. Chairman.
You're muted, Mr. Chairman.
Thank you very much. Chair recognizes the young lady from California, Ms. Barragon, for 5 minutes. Seems that she's not with us. Let me, in the interest of time, thank the witnesses for their valuable testimony and the members for their questions. Before joining, I ask unanimous consent to submit a statement for the record from the Robert Wood Johnson Foundation. I understand Ms. Jackson Lee has a unanimous consent.
Yes, Mr. Chairman, can you hear me?
To the region. And
Can you hear me?
Yes.
Ms.
Jackson Lee.
Thank you so very much. I ask unanimous consent to place into the record current COVID-19 statistics in Houston, Texas, as of 7 a.m. at 7/8/20. Texas coronavirus timeline, Houston Chronicle, July 7th, 2020, which captures the demise of our success story and also where we are today. Houston Chronicle, evidence growing that Houston's main coronavirus strain is more contagious than the original, dated July 4th, 2020, and a pandemic plan was in place by Stat News Trump Abandoned It, and Science in the Face of COVID-19, dated May 17, 2020. Ask unanimous consent to place these items into the record.
Without objection.
Thank you, Mr. Chairman. He's going out. He's going out. He's muted himself because he's talking. Turn this up.
Thank you very much, Ms. Jackson Lee. We now have Ms. Barragon from California for 5 minutes.
Thank you, Chairman Thompson, for convening this hearing today. The Trump administration's response to the coronavirus pandemic has been inadequate. We have seen the pandemic raging through our country. We're seeing spikes. We have heard from public health officials that they tried early on, Dr. Bright in particular, to warn this administration, to request that they immediately start getting PPE. And that advice was not followed. We're still in the first wave of the pandemic, and public health experts warn of a disastrous second wave if we do not reduce the spread of the virus. So it's crucial to ensure the federal government leads by both example and through direct assistance, and that any and all reduction measures implemented or advised by the government are backed by science and our public health officials. I want to start my first question, Dr. Shah and Mayor Shelton. As part of the response to homelessness during COVID-19, FEMA has committed to reimburse 50 to 75% of expenses for shelter and temporary housing through their public assistance program category B. Having arranged this large makes it difficult for a continuum of care and other jurisdictions to project funding plans as this range is large. Along the same lines, we've been told that it could take 4 to 5 years for localities to receive FEMA reimbursements. Dr. Shah and Mayor Shelton, can you comment on what effect this has on the uncertainty of the ability to respond to the pandemic and recover from the crisis?
Congresswoman, I'll go first only because you said doctor first, so I'll just go first and then turn it over. There are two inherent questions that you're asking. One is about homeless individuals and those that we're absolutely concerned about in our communities. Obviously, the concern about the inability potentially to isolate and/or potentially to spread infection if they test positive. And on the flip side, the other question is really about the longer term impact of uncertainty in reimbursement. And I think both are critical. We have to do what we have to do to protect our communities now. And we oftentimes are thinking, unfortunately, of doing what we have to do today and then hoping that there is not this delay in the reimbursement side, because that then obviously gives that uncertainty gives pause, because there's only a limited number of dollars that you have to be able to do what you need to do to protect the community. And with that, I'll yield to the mayor.
Mr. Mayor, I think you're on mute.
Sorry about that. Thank you, Doctor. Thank you, Congresswoman, for the question and opportunity. During the COVID crisis, we have continued our homelessness outreach here in the city of Tupelo. We contract with an organization, Mississippi United to End Homelessness, here in Tupelo. So we have continued those and just tried to do the best we can as far as safety precautions, masking, that type thing. But we've continued our efforts there. I can speak firsthand to the FEMA issue, though. We had a tornado, F3 tornado, hit the city of Tupelo in 2014, caused widespread damage throughout the city. President Obama quickly declared national disaster. We got federal aid that was desperately needed and greatly appreciated, but we're still, over 6 years later, we're still dealing with the red tape for reimbursements and that type thing. So, 6 years later, even though the help, we requested it, the president was gracious enough to send that help, but we're still dealing with that now as we're in a new national disaster, with
Right.
this. And we've
Thank
had
you.
other things along the way.
Thank you. Dr. Shaw, you, in your written testimony, talked about the Public Health Department in Harris County faced strong pushback from congregate settings to investigate and test within facilities due to overlapping state and federal jurisdictions of facilities. I happen to represent Terminal Island Federal Prison, where there was almost a 70% outbreak of COVID-19. What specifically should the federal government be doing to help local public health departments combat the spread of coronavirus in congregate facilities?
Well, thank you, Congressman. That first, it's that support with resources, tools, what's worked in other settings, that technical assistance. The second is really a markedly more nuanced look at what are the authorities that are available, whether it's through the federal government or working with state governments to allow for public health departments to be able to assess and test in these congregate settings. In nursing homes, obviously, that is the highest level of concern in many ways. And I will say that our state was able to work with local health authorities to allow us to be able to go in and assess. But when we get past nursing homes into other tiers, it becomes more of a knocking on a door or sending correspondence and not being able to have the authority to go in unless you have a bona fide proven case. And that's the limitation that we have. And so this is where the federal government can really help with strategies and technical assistance. And if necessary, changing some of those authorities that would really allow, especially in a crisis like this, to be able to have public health departments or health authorities like myself to be able to do more so we can protect the most vulnerable in our communities.
Thank you. And with that, I yield back.
Thank you very much. Chair now recognizes the gentlelady from New Jersey, Ms. Watson Coleman.
Thank you, Mr. Chairman, and thank you for holding this hearing, and thank you to each of the witnesses for sharing very important information with us. I'd like to just sort of establish a chronology that I think is relevant to our discussion here, because everyone is talking about, at least on my colleagues on the other side of the aisle, about having never been here before and experiencing this virus and this pandemic and not ever having had this experience. I want to hearken us back to 2005 when the Bush administration released its national strategy for pandemic influenza, recognizing the prospects of a pandemic and saying that there needed to be greater coordination in domestic production and stockpiling of medical supplies, et cetera. And then in 2016, the Obama administration developed a strategic playbook on pandemic preparedness, a 69-page guidance on fighting pandemics. And the incoming administration, the Trump administration, was indeed briefed on this playbook's existence, but reportedly didn't heed the advice. Also in 2016, the Obama administration, recognizing that you had to elevate these issues to the highest level, created the National Security Council Directorate for Global Health Security and Biodefense in the White House, something that this president disbanded in the office in 2018. In 2017, the Department of Defense finalized a report on the pandemic influenza, saying that a catastrophic biological incident could threaten the nation's human, animal, plant, and environmental health, et cetera. Months before that, the Trump administration eliminated a position of a medical epidemiologist, which was embedded in China's disease control center, and leaving that post left us without on-the-ground knowledge when things were heating up immediately. I say all that to say, and there's even more than that, I say all that to say that there was forewarning, forearming, and guidances on how to deal with something of this nature. And the one thing that was prominent in all of these discussions and these guidances was that you needed strategic, coordinated leadership at the very, very top. And instead of talking about this virus being a hoax, talking about it having limited severity, talking about it being something that was just going away, the opposite has absolutely happened. And this administration has been an abysmal failure in keeping us Americans safe from the ravages of this pandemic. I also wanted to just say for the record that we've been criticized for not being in Washington face to face doing business, because the Senate is face to face doing business and the White House is face to face doing business. But we know with the Senate failure to pass the HEROES Act and the White House failing to deal with these issues of coronavirus and trying to shut down any kind of medical information that's coming out and guidance, that neither of those entities is doing a job, even though they are face to face. But having said all that, I got one question. Why am I still seeing lanes and lanes and hours of cars in line waiting to be tested at this stage in this pandemic in any state? And why, oh, why, oh, why is it taking more than 24 hours to have the results of the tests that we're taking, so that the contact tracing that would take place would be relevant and helpful? And so I want to ask that question of Dr. Shah and of Colonel Hastings.
Thank you, Congresswoman. First is that the lines obviously are because we're seeing, at least in our communities, we're seeing increased demand with limited supply, and there you go, there you get the result. On the lab side, which I think is a really critical piece that I mentioned at just quickly earlier, that is an ongoing issue. Even on our FEMA federal sites, the turnaround time and lab results is a problem. And sometimes it's a couple of weeks before we get those results back. It's gotten better, but it's not where it needs to be. And so the individual may not get their lab, and you know how it is. If any of us don't get a laboratory result, and what it means for us as a person, and what it means for the physician or the healthcare provider, and absolutely to public health, it is a problem, because as you said very, very appropriately, it delays the entire system. And here's the final answer. We don't have a system, especially electronically. We should have a system. So this should not be happening in our country today.
Is this not something that is attributed to the fact that we haven't had a rigorous, rational, and consistent federal leadership and coordination around these issues?
I think there are a lot of things that play into this. I do think it starts with the federal government, but it is not limited to the federal government. I think there is something about how commercial labs are doing things, the reporting, the requirements. We're getting incomplete, inaccurate. Sometimes we're just being told, Umair Shah, no contact information. Before we can even trace the context, we have to go trace the case and figure out who that individual is. And then 4 or 5 days later, from a different line list from the state, we get that same individual as a duplicate. And now we have to go back and match. And then we're getting it by fax. We're getting it by email. We're not getting it in the format that should be required. Again, we don't have a system.
Thank you, Dr. Shah. I submit to you that still has to do with the lack of leadership, guidance, regulations, and accountability, suggestions, and helpfulness on a part of this failed administration. And with that, I yield back. Thank you, Mr. Chairman.
Thank you. Gentlelady yields back. Chair recognizes gentlelady from Orlando, Ms. Val Demings.
Well, thank you so much, Mr. Chairman, and thank you so much to our witnesses who are with us today. Dr. Shea, with regard to the vendors for testing kits, could you explain in more detail what challenges you have had with unreliable vendors, particularly regarding their efforts to sell you emerging testing technology?
Well, Congressman, this is an ongoing issue for us, and I will tell you that being the third largest county in the United States, and when vendors and others see something in the news, then whether it's contact tracing or laboratory or something else happening, they make contact. I put my email information. I'm active on social media, so people try to contact me directly or our team members. And I will tell you, this has really been a problem because there has been there hasn't been a great way to have a clearinghouse, if you will, of the minimum of what you're looking for. And this is where, I know the FDA has made strides. It's been overwhelming because there are so many vendors, but that's a role that can also be at a federal level to really help give that technical assistance across the system. The other piece of this, which I think is critical, is that everybody is become an expert in all of these, right? So contact tracing, now everyone says, I can do contact tracing for you. And the moment they see an increase in activity, some are doing it out of the goodness of their heart because they want to help, and others, unfortunately, are doing it because they want to make a buck. And it's really hard to decipher in between, and that's been a real challenge.
Doctor, you talked about how the federal government could perhaps help in this area so local health departments and others don't have to try to figure out what's reliable or what's not. Could you give me some examples of how you feel the federal government could be a greater help to you?
Sure, and I've said this in both my oral testimony and also my written testimony. So please, if your staff can look at that more closely, there may be some additional ideas here. But I think in general, what it is that we are left fending for ourselves. It feels that we are learning every day something new, and as the Congresswoman from New York had mentioned just earlier, instead of being able to learn from those other entities across the system and/or getting the federal guidance that says, here's the minimum standard that you should be looking at, you should be utilizing, or here are the kinds of things you should be looking at. I get that we have to be careful on the private sector. We can't say, not this one, not that one, but at least give us those minimum standards that allow us to make informed decisions. That really would help us rather than for us to be trying to do this on our own. And that's a challenge for us. And it remains, and I suspect it will remain for the next several months as we continue in different phases, including in the vaccine world. As soon as we get to vaccines, it's also going to be this whole piece about how do we get supplies to you, how do we get other materials to you, who can do it better, who's going to, and again, we're going to have this avalanche of people reaching out, and we're not going to be able to handle all those requests.
And then finally, I know we've been talking about the lack of PPE equipment since the very beginning. But as we approach the fall and, the stories of, are we going to see a resurgence? We aren't really sure what the landscape is going to look like. What particularly concerns you about supply chains leading into the fall?
Well, Colonel Hastings said it really nicely, which is that all of it concerns us, and really it's obviously what's happening in the healthcare system. We want to make sure we protect our healthcare providers, our first responders, the ones who are repetitively being obviously in contact with the COVID positive patient. In addition to that, we really are very concerned about making sure that the supply chain constraints are alleviated as we continue to have more demand as you get into the fall season, again, with flu and other infectious diseases. They did not miraculously go away. They have not miraculously made room for COVID-19. They are still there, or they will be there. And we have to make sure that whether it's gloves or masks or gowns that these, or lab materials, that all of these are really there, and the constraints are not, again, left to locals or states trying to figure out what's the best way to procure for their communities.
Dr. Shah, thank you so much. Mr. Chairman, thank you, and I yield back.
Thank you very much, Madam Congresswoman. Let me thank all of the witnesses again for bearing with us through some of our technology challenges, but the information you provided us has been very, very helpful. We're trying to get it right, not only because as Americans we have a responsibility to do that, but it's so very important that in getting it right, we can also save lives. So your testimony has been very, very helpful. The members of this committee, however, may have additional questions for you, and we ask that you respond expeditiously in writing to those questions. Without objections, the committee record shall be kept open for 10 days. Hearing no further business, the committee stands adjourned.